Hi, everybody.
Hi, Mary.
Hey, Mary.
Hi, Mary.
How are you?
Oh, God. Didn't I see Dave Crenshaw before? Wendy is with us. Welcome to the committee, Wendy.
Hi, good evening. Sorry, I'm just getting home from work, so I'm gonna have my screen on in a few minutes, just getting myself acclimated.
All right, there's a conflict tonight with the land use committee, so I believe Tanya is going to be over at that meeting instead of this one. Betty Lehman called me to say that she would be late. Catherine Diaz is now with us.
Sally, you get a haircut?
Yep,
Wow. Very nice.
thank you.
Dave,
It was actually my COVID cut. Makes it a lot easier.
Oh, yeah.
Sally, I went a year without getting a haircut in COVID. And if you ever want a good laugh, I'll show you the before and after.
Good. I would like to see that.
oh God, I had a cousin whose a kid went without a haircut for 3 years. And at the end of the third year, they had a big ceremony. It's his first 3 years. Oh, shoot. All right, I guess maybe just a few more minutes. Oh, good. OC is with us. All right, I just want one more committee member.
I'm here.
Oh, I didn't count myself. Okay. All right, we actually have a quorum. All right, I'm just going to wait a couple more minutes.
Steve, did you get my emails?
Yes, I have information for you on textile recycling. And on the other item, that's a question you should ask Julio.
Okay. Do you also have an answer about the first email I sent a few days ago, not related to Community Board 12?
Oh, damn it, I didn't answer you, did I?
No, you didn't.
Do you still want a contact there?
Yes,
All right, I'll do that later.
thank you.
Steve, I had a question. I have a question for you.
Where's it coming from?
Mary
Oh,
Anderson.
Mary. Yeah, go ahead.
The question is that a while back, sometime during the pandemic or the end of the year, you had changed your meeting back to 6:30 to go along with a lot, what a lot of the other committees were doing. Is your intention to stay at 7 again, or?
Well, I tell you, we moved it back to 7 because we were under the impression that we would be going back to in-person meetings.
I gotcha. Okay.
So we went back to what I thought was going to be our regular schedule. And then
Okay.
of course, that didn't turn out to be. It was Mr. Cochran who suggested we move the meetings to 6:30, and then now he's no longer on the committee. So I,
See what happens when you defy the chair.
yeah, that's right. So I think I think maybe we'll have, before we adjourn tonight, we'll decide if we want to meet, assuming we're on Zoom again, whether we want to meet at 6:30 or 7.
My understanding that we can continue with Zoom until January 2022.
Yes,
Right.
January the 15th at this point, the state open,
22.
the state open meetings law was amended. All right, well, I think at 7:14, we're going to call this meeting to order. Thank you all for coming. We have a fairly lengthy agenda, so we'll try to get through it as quickly as we can. We welcome back our member emeritus, Mr. Cochran, and we welcome our new member, Wendy Pena, and our other members at the moment, besides myself, Catherine Diaz, Sally Fisher, and O.C. Kamina. So we have 9 members of the committee at this point, and 5 of us are present. So we will move on, and on a topic which I think is very relevant these days, the hurricane evacuation zones. A map was recently issued by the city emergency management. I guess it should be called a department now. Is that correct? It's no longer OEM? So-
Yeah, so it's no longer OEM, so it's New York City Emergency Management. The
Right.
department, we only leave it for the legal documents.
Right. And as it happens, the agency's director of intergovernmental relations is someone who is very well known to Community Board 12 and previously worked for Councilmember Rodriguez and is a resident of our community and has a vested interest in making sure that we are well informed and up to date on the city's situation with respect to the hurricane evacuation zones. Now, because most of Washington Heights and much of Inwood is on a higher elevation, we don't seem to be, for the most part, eligible to be declared an evacuation zone, except for several areas of Inwood. And there are 6 different categories of zones, which Yokarina Duarte will explain to us, and then explain, I'm sure she'll tell us at what point does that get triggered, and do the zones come into play, and do residents of Inwood or any of these other zones, are they advised or required to evacuate their residences? So Yokarina, the floor is yours. Should we, I think we probably should post the map, and I'm not good at doing that. I'm disabled. I can't do it.
I think only Ebenezer at this point will be able to if he started the meeting, unless he gave the control to anybody else in the room. There you go.
Oh, very good. All right, so here's the map. And as you can see, along the edges where people don't live for the most part along the Hudson, that area is declared an evacuation zone. But up in Inwood, we have every color possible for evacuation zones, and including the Baker Field complex and the Allen Hospital, which surprised me because I thought that was on might not be affected because it would be on a higher plane. But Yokarina, explain this all to us.
Well, thank you, Steve, for inviting me, and hello, everyone, and hello, community board members. Like Steve said, my name is Yokarina Duarte. I'm Director for Government Relations at New York City Emergency Management, which is the coordinating agency for emergencies in the city. As you mentioned, yes, New York City Emergency Management actually is the coordinating agency for weather-related, most of the weather-related incidents, including hurricane and coastal storm. If you remember back during Sandy, the city had made, before Sandy, the city had made a map that kind of showed the areas where, the flooding of the water from the river used to come into land. And after Hurricane Sandy hit the city, we have changed the map. So before the maps were considered area A, B, and C. And after Sandy, especially, we did the study, we saw that more water came in than what it was expected. So the map have been since revamped. So we no longer have zones A, B, and C. Now we have zones 1 through 6, which shows, depending on where you are, whether you are directly impacted by water or you're gonna be less likely impacted by water. We also have the area that are white, and most of Washington Heights isn't white area, which means that is a higher elevation. Therefore, you will not see most of the water coming into land. So that's why there are color codes, so people know that they're different areas, and we have increased it to 6 area now, and before there were 3. In addition to that, we have a campaign called Know Your Zone, which is basically telling New Yorkers you need to know whether or not you live in a zone. And what does that mean? If you live in a zone, you're most likely, depending on what we're expected in the city, to be evacuated. What does that mean? Evacuation happens once we know that, certain areas within the city are in a threat from getting water inland. Like I said, there's 6 zones. You need to know whether you live in one of those 6 zones, or if you, like me, which I live in Community Board 12, I live in an area where it's not a zone. Well, many of my family members do live in an area that are in a zone throughout the 5 borough. So you have to create a plan, and that's where the recommendation it is. So what does that mean if you live in a zone 1 versus you live in a zone 6 versus you don't live in a zone? The red area is zone 1, and it goes from 1 to 6. They're different color codes. So we recommend New Yorkers to go to our website, Know Your Zone, and find out, plug in your address and find out if you live in one of the zones. Because if we are likely to get affected by the coastal storm or hurricane, and this is when this activation start, and we will be announcing and saying, hi, New York City, we will have to evacuate certain areas, and the mayor will start talking about what areas will be evacuated. Again, it all depends what we'll be expecting. Before that happened, we'll be in constant communication with the National Weather Service to know what the threats are for New York City. And we will be doing not only maps and things to know what are the critical facility within those areas that we're going to be evacuated, and putting out messages so people know. But it's important that you do know in advance, if you live in an evacuation zone, that you know which one is your closest evacuation center. So when the mayor decides to put forward with this decision, and the city decides to go forward with this decision, you know ahead in advance. There are different centers, evacuation centers that are open up so people can go if we activate, and we decided to evacuate the zones. So these centers right now are not open, so you cannot just walk in, because a lot of the centers are public schools and different city facilities that we use to open up the centers. So don't assume that right now you can just walk in and just stay there. It has to be in order to declare that we are actually opening up the center, because we are evacuating any of the zones. And we'll be very particular saying which zones are and where you can go. But in advance, you can plan that and find that information on our website. Like I said before, if you Google Know Your Zone and you go to the finder, you can actually plug in your address, and it will tell you not only which zone you live, and then it will also tell you which one is the closest evacuation center based on the address that you plug in. And that's why it's important that we're having this conversation today, so you know in advance, and you can plan in advance, and you can have a plan for you and your family. I know a lot of people don't like to go to evacuation centers, but just to let you know, you don't really have to go to evacuation centers. What we're asking people is to get out of that area, so like that the city can actually take measures and make sure that you're safe, and you don't have to put first responder to the risk, because now we have to go and get you because you decided not to evacuate. So the recommendation is to go to a center, if an evacuation order is issued, to go to a center. And if you don't want to go to a center, you can actually stay with family members, which is the plan for most of my family, to come up here, Washington Heights, because where I live, like I said, I'm not in a zone. So that's their plan. But again, it's important that you create your own plan. You can find additional information on our website. So what does that mean? What would trigger an evacuation order? a lot of people like to think about what category hurricane would trigger an evacuation. At emergency management, we don't like to think that because we have seen tropical storm with less wind force than a hurricane coming into the city and causing much more disruptions. So that's why we don't like to talk about, okay, the hurricane Cat 1 will come, how many zones will be evacuated. We always like to think about what is coming. It's a tropical storm. What is the wind? How much water was expected to come inland? And that will actually trigger different things, not necessarily an evacuation order to be issued. For instance, during tropical storm Isaias, it caused a lot of disruption and a lot of issues in different boroughs. And not necessarily we had to issue an evacuation order to put in place different plans. Like I mentioned before, when we know there's a potential threat, we'll be in conversation with the National Weather Service. We will be activating our operations center at Catman Plaza in Brooklyn, and in bringing in agencies to take measures that we can actually implement prior having water to come, having rain or a coastal storm inland. That actually been happening for a long time. We will probably activate the flash flood plan, which means that a bunch of agencies, including DEP, DSNY, and other agencies will be activated to kind of help out mitigate that the water actually have a place to go. But again, we have seen storm like the recent one, Aida, in which you get so much accumulation of water, and it was not even a hurricane, so much accumulation of water, and you get flooding because of the amount of water that was falling per hour into our sewer system that could not hold that amount of water. And, and just because of that, different boroughs were affected. I know Manhattan was not declared an emergency declaration, but all the boroughs were because they were severely affected. And that means that, we are taking proactive measure to make sure. So that's why we don't like to talk about whether or not it's a Cat 1 or Cat 2. We like to talk about what is coming. It's a tropical storm. It's the reminiscent of tropical storm. We like to look at the potential of what the wind gusts. We like to talk about, what other issues can bring, because again, it's not only water inland. You can be getting blackouts. You can be getting many other disruption, such as down trees that can cause power outages. And, there's a lot of things that need to be taking place in order for the city to respond to all of that. And all of that is coordinated by emergency management with all our agency partners. But I had to say that, yes, if indeed we get something to the city that might be a threat to the city, and we have to activate, in order to evacuate, most likely zone 1, which is the red zone, will go first. And then it will move on depending on where we see the threat. But again, it all depends the path of the storm, the wind gusts, how much water it will affect, not necessarily whether or not it's a hurricane. In addition to that, it will really depend on so an evacuation, in order to be triggered per se, specifically, we will have to have 7 to 10 feet of storm surge, which is usually like around 10 extra feet of water above the high tide line of the shore. So that's a lot of water to come in order for us to activate, an evacuation order, to issue it, declare it, and make sure that now we're moving people out of those red areas into evacuation center. And this is for the whole city, or it could be depending on what the path of the storm it is going. That will actually trigger that. I know you mentioned, Steve, that the Allen Pavilion is on a zone. So it is very tricky, right? Because when you go to the map, you can plug in an address and it will tell you whether or not the actual building is now, but part of the complex, the Allen Pavilion is out of the zone. Part of the complex is out of the zone. However, that does not mean that the city doesn't work with the public and private entities to ensure that they have a plan as well. We do work with hospital, whether public or private, to ensure that they have a plan and that we can assist in case they need. Because like I mentioned before, we're not only talking about water, we can be talking about a tree that can fall down, affect the power within now a hospital. And, obviously we ask them to have generators, but it could be issue with generators, and you might need fuel for the generators and other things that the city do help facilitate when that happens. But in addition to that, we have a program that we talk with all our critical facilities in advance to let them know and message our information that we know as we know it. So since we will be coordinating with the National Weather Service information, days before we might get potential heat, whether it's just rain or wind gusts and other things that the storm might bring to the city. We'll be messaging out to all our partners, whether public or private, to ensure that they are taking necessary measures to prepare for any potential storm that might affect the city. I know, some of you were concerned about the subway system based on what we saw recently, which it was not, like I said, a hurricane. It was a reminiscence of Tropical Storm Aida. And I know some of you are concerned about the subway as well. I had to mention that the trains are overseen by the state, and they do have their plan as to when to move and stop services. And usually that decision, when it's made, they usually is communicated with us to ensure that the city know what's going on. So we do work closely with the state to get information as for what is going on in the public system, transportation system, I should say. But at the end of the day, it's up to the MTA to decide whether or not they're going to move trains to higher ground, or they're going to move it from one location to the other, to ensure that, that they're able to mitigate any issues that they have, including waters in the train. But we do assist when they request the help. They're part of our emergency operations center where we activate them. They are part of the conversation. And it can be a coordinated effort when they flag things for us. Like I know during winter weather, they flag that they need help sometimes with sanitation, cleaning up certain areas. And I know that that's something that has been provided to them when requested. But again, that's why it's always good to have one place where they can coordinate all of these different responses for the different emergencies. So the Dykeman houses, obviously, if you look at the map, the Dykeman houses are in zone 2. And in this area that, it's vulnerable, because if you look at it, the Sherman Creek area is one of the lowest area in it, and that's where the water would come in behind PS5. And we also see the Dykeman, La Marina, obviously because of the way that it is, what the water is, and the way that that area in the park is elevated. So that was a concern back after Sandy. Before Sandy, the area was not completely included. After Sandy, that area got included, and that's why it's now zone 2, because we saw a lot of water coming into inland in that area, and that's why it's zone 2. Now for the Dykeman houses, they are in zone 2, like I mentioned. We work very closely with NYCHA, not during the coastal storm, but every season to make sure that we assist them with the emergency. As far as I'm aware, NYCHA does a lot of emergency training. They have their own plan for their residents. But if indeed we have to issue an evacuation and they are in zone 2, we have to evacuate zone 1 and 2, definitely we will work with NYCHA's authority to make sure that the residents have a place to go and that they understand. They do a lot of trainings for NYCHA. I've done a lot of training actually in different NYCHA complex to the tenants to make sure that they understand that, they might be at risk during a tropical storm or for any other type of emergency. And I had to mention that we do have certain members, which are volunteer core group, community emergency response team that lead with the NYCHA complex that can help us as well, to help expedite anything that needs to be done. And like I said, if an evacuation is indeed in effect, NYCHA will be working with us at our emergency operations center. They usually are called in for any emergency, not just hurricane season, so we can help and mitigate any issues that might come up, not only water in the complex, but also power outages, elevators not working. And we work with NYPD, DSNY, many of the different agencies to make sure that we can actually assist with anything that they have. I know a lot of people wondering what's the difference between the flood zones and then the hurricane evacuation zones and the FEMA flood risk maps. So this is slightly different. So basically what it is, New York City hurricane zones are usually the FEMA map were created for insurance purposes. Our were created for life safety reasons. Again, that's basically the easiest way to put it out. The FEMA's flood protection risk maps that were put together as a way to indicate regarding whether it's a rain, whether it's a hurricane, whether it's tropical storm. This is the potential amount of water you will get, right? And therefore, you should have an insurance for the particular area. The one that we create is for life safety purposes. We want to make sure that New Yorkers know that they live in an area where it's a risk. And we want to make sure that New Yorkers get prepared. That's why the whole campaign Know Your Zone is created. And we want to make sure that people plan in advance so they know their options and they can decide before an emergency, not while during the emergency. And people can make the right decision to leave instead of staying and putting at risk our first responders' life. I know another question that was brought to my attention was what has changed since the creation of the maps. Well, a lot of things have changed since Sandy. A lot of different departments now have created different campaigns to help and educate New Yorkers on how to be ready, not only for tropical storm and hurricanes, but also for any other emergencies. In addition to that, the way contractors now have to submit within their once they submit their plan for building for creating a building within any area. Part of it is that they need to know whether or not that particular project is in a hurricane evacuation zone, and they have to, they're mandated now to put most of the critical equipment above ground, not at the basement, how it used to be done when building new facilities and buildings. In addition to that, there was a law created to make landlords to mandate landlords to inform the residents whether or not they live in an evacuation zone. You know, and that's something that the Department of Building is overseeing with collaboration with emergency management, which we're the one providing the information, and we provide the stickers to, you know, whoever it requested, so they can actually inform the residents whether or not they live on it. So your landlord should be providing that. It's done through DOB to make sure that that's happening, and we're at the agency backing up, making sure that people have, that the landlord receiving the material once it's requested to us. These materials can be requested through 311. Anyone that would like this information can be sent to your house in different languages, 12 languages to be exact. And this information is online as well on YouTube channel and different platforms that we have, especially in our website. So not only you will get copies of the map, but you can also create your own emergency plan and have a guide that you can do step by step with your family. So to repeat and to conclude my presentation and allow for questions, I just want to remind that the most important thing about this whole presentation is that, one, you need to know whether you live in a hurricane evacuation zones. The zone are activated if indeed an area is at risk due to the amount of water that we might get inland. It's different from the FEMA's flood maps, which basically were created for insurance purposes. This is for life safety. We want to make sure that New Yorkers are safe, that you know if you live in a zone, that you plan in advance, that you take your actions to prepare and prepare your family to ensure that, you know, a hurricane comes or a tropical storm comes, and we're talking about hurricane evacuations and you're not sure what those that even means. So there's a lot of information. We hope that this presentation is have a lot of information that you learn from it, and you know, ask your questions, and you contact us if you need us to come back and do a similar presentation. And thank you for the opportunity.
Thank you, Yokarina. I have a couple of questions, and then I'll turn it over to a couple of board members and to the public. My first question is, again, with the Allen Hospital. So it's not in zone 1, but is it in zone 2? Is it vulnerable in some way? And have you been working with the hospital to come up with a plan by which they would be able to evacuate their patients?
So this is what is tricky, right? If you plug in the address of the Allen Pavilion, based on the address, it's not in a zone. For part of the complex, it might get water into their complex, right? So as I mentioned before, the Allen Pavilion is actually part of the Presbyterian Hospital, is part of the Greater New York umbrella, which oversees all private hospital. And then you have all public hospital within the Health and Hospital, which oversee, and they work extensively with us. We do have an emergency. We have a division that is health and medical, and they do message out to all of our partners. If we know something as simple as, we had an issue last week at the Harlan Hospital, which their air conditioner was not working. We will be in contact with that particular institution, and we assess and see how we can assist. Like the city do not, whether or not you're private or public, we do assist and we do come out. I know we had instances in which emergency management, very rare, had to come up to 168 to respond and assist the hospital. But they're really good. They have everything under control. So we're here to assist, definitely. And if the transportation needs to be moved, I'm sure that that's a plan that they have in effect. I think the hospital can speak better about their own emergency plans than I can. But part of it is to assist if it's needed. But each institution should have a plan, and they work among themselves to see where they can send the patients and how quickly they will have to know. But we'll be in constant communication prior to having anything hit the city with our partners at the health and medical family to ensure that they know in advance and they can plan in advance.
All right, but so to clarify, when you say that it's not in any zone, it's the equivalent of the areas that are in white?
Yes.
Oh, okay.
So
all
yeah,
right,
if you plug in the address right
Okay.
now, you will know that
okay.
it comes in the Y area. So that means that it's a high
Okay.
elevation. So, but
Okay.
if you look down a little bit, part of the facility within the hospital might be close to zone 1 and 2. So yeah, they might get water inland, but not the particular building per se, but all the
Okay.
part of the building might be.
All right, well, maybe the other end of the complex where the tennis bubble is, which is, more on low-lying land. Maybe that's what triggers that zone 1. And let me ask you, maybe it's just common sense. I'm assuming the reason that there are no evacuation centers in Inwood is because most of Inwood is in one of the zones, and you're not going to seek refuge in a place which might also end up being evacuated. I mean, is that why there are no evacuation centers in Inwood proper?
So we like to put centers in areas that are not going to get evacuated. You're correct on that.
Okay.
That's why we put it, but that doesn't mean that we might not have 1 or 2 in Inwood and it might not be open to the public, or, so this is the way it works. For our evacuation centers, we do publicize some of them, but we have some others that are not publicized. And which means that we might be having George Washington during Sandy. We had George Washington as the center, right? For Washington, we had George Washington, and we have one of the Miraval School, if I remember correctly. And they didn't fill to capacity, so we didn't need to open any others. So we do work with Department of Education and many different of the facility. Obviously, we will not open PS5 as a shelter when PS5 is right about the water, and that's actually considered in the zone. So we will definitely work and have all the centers open, but there are some center publicized, and we ask people to know in advance where they are and make sure that you know in advance.
Yeah, I was thinking that maybe the Good Shepherd School, which is on higher ground, that might be a potential evacuation center. In any case, OC, you have a question?
I have a question, yeah. So if you look at the map, actually Inwood is kind of becoming, if it's flooded, it's kind of becoming like an island on the island, because Dykeman is the fault line where everything going to be flooded. NYCHA, we already discussed, will be flooded. Con Edison will be flooded first. And I don't know how we're going to communicate with each other once Con Edison is flooded. But what I don't hear is that, where do people go? Because that island, the only way to get out of Inwood will not be going south to Washington Heights, because again, Dykeman will be flooded. That will be trying to get to the Broadway Bridge, which potentially will have some flooding issues, or walking Inwood Hill Park, going up to Henry Hudson Bridge and walk to the Bronx, walk to the main lane. So what I'm not hearing is, what is the plan? What is the actual plan? People are more likely to survive when they know where they're going. So I understand why there is no evacuation center in Inwood. I get it. But where are we going, and how are we going to communicate with each other when Con Edison will be flooded? Also, NYCHA residents, where are they going? Yeah, that's, I think, the,
All right,
it's,
let Yokarina respond.
okay.
Perfect. Thank you, Ozzy. Yes, you're totally right because of where the Con Edison plant is. They might be at risk, but every single a company that is out there and department that have facility there have been made aware that they are in an area that can be flooded, and they need to take precaution measures to ensure that the Washington Heights network, which is basically goes all the way from Inwood, all the way to Harlem, that is protected if something as big as a storm will come. And that's the first answer to your question. Second answer, you're asking where can we go? It's very simple. If you want to know where you should go, what the evacuation center is for you, you need to go to Know Your Zone, plug in your address and find out which one is the closest evacuation center based on where you live. That's actually the right answer to your question, because like I said, there's people that don't live in the area, people that do live in the area, people that might want to leave and they don't live in the area because they might be afraid that they get caught because of the amount of water that we might get. For you to find out where is the closest one, you need to go to Know Your Zone, plug in your address, and it will tell you which is the closest evacuation center. I know I mentioned someone had a question on the Q&A that mentioned that I've been talking about hurricane, but as I mentioned at the beginning, we have all the coastal storm and summer storm that have caused way issues than, you know, they say it have caused a lot of issues. So yes, we're talking about both tropical storm and hurricane.
Oh, very good. Sally,
Yeah, how are you addressing the risk? Because we don't have the right infrastructure for wastewater management. So how does your office address that? Because wasn't that the problem last week?
Sally, can you repeat your question again? I'm sorry.
Sure. How are you dealing with infrastructure issues like the lack of facilities to handle wastewater? Because wasn't that the issue last week? And so, you know, this map is great, but it's not, it wouldn't have done any good last week.
Yeah, so this map is for hurricane and coastal storm. And, you know, the one that the FEMA does is flooding. It's totally different. I want to clarify that. I want to make sure it's different. You know, the flooding one measures the amount of water that you get even when it's raining. And I had to tell you, Sally, a lot of the things that we're learning is we're using a lot of the data, and that's why the zones have been amplified and created more zones to be able to identify areas that before were not flooded due to potential storm surge. That's what we're talking about. So I understand your question, but we're working with ORR to identify areas that are vulnerable and to create something that's called the IFPN, the interim flood protection measure, to identify areas that get potentially flooded just by regular rain. Not even talking about a water surge from a hurricane or tropical storm, to identify those areas and see what measures can the city take to protect those areas. And that's what we're working right now. We haven't gotten to Inwood yet. I know there's different areas that are being flooded. Like I know there's other areas that get flooded just by regular rain. So that's what we're concentrating now. Then we're moving forward as we continue to secure funding for that program.
Okay, then my other question.
well, let me just say, Sally, I've reached out to DEP, and it's an allied problem that you raise, but I think it requires a separate discussion. So I think I'm going to try to schedule DEP to talk about the wastewater and combined sewer overflow issue.
And how does this map filter into other discussions, like when a rezoning is going on? How do we end up approving buildings in a floodplain? And how will that be addressed in the future?
Well,
So-
again, strictly speaking, we're not, Yokarina can answer this, but we're not necessarily talking about flood zones today. We're talking about hurricane evacuation zones. I mean, again, they're related perhaps, but not exactly the same.
But she does have a point, Steve. Obviously, the number of residents. within-
Sally always has a point.
Yeah, so the number of residents do trigger the amount of centers that we need to explore and open. So we do look at, you know, different things in order for us to open up more centers, more evacuation centers. Like I said, right now you could have 6 open right now in Washington Heights, but that doesn't mean that the whole universe is just 6. It could be that we have 25 and we haven't just published the rest because we're waiting to make sure that people go to specific center so we can staff it. We can put all the stuff that needs to go in there. And then if they start filling up, then we can move and open up the rest of the centers. But for now, what we're sharing right now is what we think is significant and is important and is just for the amount of people that we might get, and then we might open more.
Okay, you don't have to reveal all of your secrets.
It's okay.
Any other committee members? Otherwise, we turn to Darrell, our emeritus member.
Thank you. No, I was just looking again at the evacuation centers. So there's just two in Washington Heights, is in Wood, correct?
Yeah,
ES 48 and IS 90. Okay.
yeah, as of right now. But I know in the past, we have used all the schools and all the facilities, and we have a strong relationship with EOA to make sure that we're able to open whatever we need to open. And during an emergency declaration, like if a hurricane were to come or a storm were to come, obviously emergency declaration will be issued. It gives the city and emergency management the liberty to even implement more stuff. So trust me, those are the two open right now, but that doesn't mean that in the back end we have more in case we need to open more.
Okay, well, right now, nothing is open. We're not in a hurricane at the moment. Darrell, go ahead.
Oh, no, I was just gonna say too, I noticed like in the directions, it will direct you to like walk to a bus or to a subway station. So we're assuming the buses and subways are running. And is that changed, on an immediate basis during a hurricane situation?
So it's funny because somebody else asked a question on the chat that I'm monitoring right now, and they asked similar question. We had evacuation routes before. So that was a model that was started way before during Sandy, way before Sandy. And what we're telling people is just, take this route to get to this point. What we realized with a lot of studies and studying, the behavior of people after Sandy is that New York City has a lot of ways of getting to a place. You don't need to tell them take Broadway to get to 168. There's also all the street that gets you to 168. So we stopped doing that, and we actually took most of the signs that tell you get this route to get this. We're basically telling people get to Highland right now. That's actually the new model that we are. And trust me, we will be working very closely with the MTA to ensure that we know when with the public transportation will be shut down. So the message goes out so people plan in advance and they don't get stuck now without transportation.
All right, very good.
And I just had one last question. It may not be related to you all. Steve might actually know the answer to this. In terms of damages that you see in the flood zones or the hurricane zones, because a lot of that is parkland, and there are many park buildings there actually, temporary and permanent. So I was wondering what that looks like in terms of looking out for that. Obviously human life is most important, but I'm just thinking what happens with those areas.
So Steve, if you want me, I can talk, because I know, it might be a little bit of, I don't know.
I don't know how to answer the question.
Well, I can tell you this. I can actually tell you. So our emergency operations center will be activated weeks, hopefully in advance, before we know that, to keep track of whatever might be coming to the city. And that's what we always do. Something like that, we will talk to Parks Department to ensure that they are deploying different measures to ensure that they are protecting different areas. Again, the decision on what areas is protected is not on us, it's on the Parks Department, but they know that they need to take advantage of, of the situation, knowing in advance in order for them to protect certain areas. I know in the past we have worked to deploy sandbags to areas, that are needed throughout the 5 boroughs. And, we have deployed to different areas, not only just parks, but streets and other area in advance before a storm come in. So I'm not saying we have sandbags for every location that might get flooded, but I know we work with parks to ensure that different areas, that might be potential threat is protected as well. And not only parks, we work with sanitation, DOT, and many other agencies to ensure that even their
Amtrak's in that area too.
Catherine, you have a question?
Anyway, thank you.
Catherine Diaz?
Yeah. Hey, Steve. Hi, everyone. Hi, Jokarina. My question is 311 still the main way of like reporting and for like just say residents, for example, right? Because I think, with the last few storms, we find that like to know about certain street closures or certain incidents at train stations, you learn first through social media, through viral videos, right? Versus like the text alerts that usually the Office of Emergency Management or like the city would put out. So, I mean, I guess my question is, are there any new methods to reporting, streets or buildings or like dangerous conditions by residents in the area?
So, yeah, so if you have any condition on the street, report it 311. If it's dangerous condition, you should definitely call 911, especially if you see down cables, down trees with cables on it, that should be reported immediately, because again, we don't know if those cables are live or if you have electricity or not. That's what we recommend. And that's why we say, like, you worry about a hurricane, but a tropical storm might cause other issues. But definitely call 311 to report that out. And there's a couple of reasons. Last week's storm, we were looking at 311's number, and we were going with FEMA different locations to see what was the damage like. And that actually triggered a declaration of emergency, which Manhattan didn't meet the trigger, but all the boroughs did. So calling 311, people think that is obsolete, that doesn't work. There's a lot of things that go through 311 that we're able to pull out. We are able to look even on an even remote situation in the winter weather. We can see numbers of 311's complaint for heat and hot water, and actually work with HPD to send inspector to that particular area and put, or increase the number of inspector that they should have. We don't tell them what to do. They just do it on their own, but we can say, hey, we're getting an increase on this number. We should be taking a look at that. Those numbers I even considered for after the storm to see what areas now is potentially, and I know I work with DEP a lot, so DEP look at all these areas, and they have to, keep the list on what areas that people are reporting issue constantly. Again, it's different for the subway, so we're monitored by the MTA, but yes, 311 numbers do work. We look at it constantly, and we recommend people to make the report through 311 because it does trigger a lot of different things within city agencies to respond. There was
Regina Gratis, who I believe lives at 99 Hillside Avenue, is
Mhm.
asking, her 21-story building is not in an evacuation zone, but what happens if we lose electricity, no power, no elevators, no water, etc.?
Okay, Regina, so there's two scenarios. Like, think about that. We have the storm might be coming, whether it's tropical storm, something, that might affect us, or whether it's a hurricane. We do work with a lot of people to ensure that you have what you need. We make sure that we message out to, different things, and we work with the buildings department to put out messages to landlords to ensure that they are protecting their tenants for any potential that a storm might bring. Not only to secure things from the property, but to also make sure that, they're messaging tenants to make sure that they have a plan. So the first thing is, what are you doing with your family? You should be getting ready and creating a plan, because a power outage can be caused by anything, especially during the summers where people consume more electricity. So emergency management has this guide called My Plan. You can create a step-by-step plan. Yes, landlords should be, helping out with making sure tenants are, have a plan, and that there's an evacuation plan in case it has to be happening. I live in a building. I know my landlord has no idea of that. I had to be honest with you. But it's up to us to make sure that we are ready for, and that we are prepared as much as we can. We cannot just leave our health, our life in the hands of others. We have to make sure that we protect ourselves. And the step-by-step messages that we give in that plan, like how you can protect yourself. Let's say, for example, if that were to happen right now, and we know that there's a building that is without electricity, emergency management working with whoever the company is, whether it's PSNG, whether it's Con Ed, we work closely with them. They let us know when they have issues with electricity, and we do response and make sure that, tenants and landlord are protected. We had an issue at the Rachel Bridge building in 180th a couple of years ago, in which there was a fire, caused a whole blackout. That's one of the tallest buildings in Washington High. That's the 4 buildings right at the highway. And you know what we had to do? We had to come out, bring everybody on board, make sure that the tenants were safe, and people that needed any help to get out of the building because the elevator were not working, they were getting the help that they were needing. And we were providing different things that the city does provide, but that's a particular case. I'm not talking about what if we have 20 buildings, 30 buildings, that will be a different scenarios. And we do have plans for that I cannot share more than what I just shared. But just know the city has plans, but you need to help us to make sure that you're better prepared, because if we have to get you, out of the apartment and you don't even have a go bag, you don't have all your documents in one place, all your information in one place, you're gonna delay first responders, and that's gonna delay the response and getting to somebody else. So that's why I say emergency preparedness starts with you at home to help first responders respond in an efficient way. So if we need to get you out, you're ready to get out and you don't have to come back for medicine or for anything else. That was one of the Regina's question. I think there was other question. I don't know, Steve, if you want me to go through it and answer it or how you want me to do this.
Allegra, can you tell me whether you have a question you still want asked?
Can I ask something really quick while Allegra is typing?
Yeah.
It's just a yes or no
Yeah,
question.
yeah.
answer.
Go ahead. But
Um,
Ebenezer, can we promote Allegra?
Yo,
Allegra?
Karina, can people evacuate with their pets?
So you can evacuate with your cats if you're talking about
Pets
your
in
pets.
general,
Yeah.
dogs, cats, whatever.
Yep. You
Okay.
could evacuate with your pets. Let me tell you this is a caveat. Give me a second, because it sounds very good. You can evacuate with your pets. You can go to evacuation center with your pets, but in the common area where everybody else is, the pets cannot be. So there has to be an area where we keep the pets, just for the reason of that you're gonna have people with COVID
Okay.
now. We have to keep the social distance, but everybody's gonna be in a common area, right? And there's people that might be allergic to certain, animals and stuff. So they have to keep it in an area where they're isolated from the rest of the people.
All right,
Okay.
that's good. Allegra,
Yes,
do you still have a question?
I do, because I'm not really satisfied with the answer she gave. So first, you keep using hurricanes and tropical storms. Oh, join as a panelist. You guys don't want me as a panelist, do you?
Yeah, we'll demote you after you ask your question. Go ahead.
Okay, sure.
Go ahead.
Go ahead.
Okay, here we go. Sorry, it kicked me off and back on again. Now I wants my video. Okay. So you keep using tropical storms and hurricanes as if the wind speed is a differential between whether or not you can have coastal flooding. But my comment was that if you look at the top 10 flood events from coastal storms in New York City, half of them did not occur in the summertime. They were not tropical in nature. They're mid-latitude storms. They're your really coastal storms. And I think for messaging, you should be saying coastal storm and not say hurricane tropical storm all the time, because it's a bit misleading about what time of the year you can have these kinds of storms that can cause coastal flooding. So you should be more careful.
Well, I did hear her say coastal storms.
Yes, but she keeps saying hurricanes or tropical storms. But
Okay.
if you look at the link I put in there, look at the top 10 storms, and you'll see that of the top 10 flooding events in New York City, only less than half of them were actually like Sandy or Hurricane Donna or whatever. They were not like tropical storm, hurricane. They were mid-latitude storms. So you wouldn't get information about those kinds of storms from like the National Hurricane Center. You get it from someplace else, right? So you just need to be clear on messaging and your thought process where you get that kind of information. The second, my comment about the evacuation route, it's not just telling New Yorkers how to get from point A to point B. Obviously, everybody has 10 ways to get from A to B. It's the fact that, for the inward rezoning, some of the densest buildings that are going in are in zone 1. And, for instance, that one that's in zone 1 on 9th Avenue and 207th Street, that's going to have over 600 units. So you're talking about 2,000 people that you're trying to evacuate out. Having an evacuation route is a way that you can keep streets from being populated from just random people driving around. It's a way to ensure that you only have like vehicles there who are supposed to be there. So I think that's a really important piece, and that it shouldn't be necessarily just knocked out. Another one of my comments was about the CSOs, like some of the storm surge actually for Sandy went up through the CSOs and, for instance, inundated the A train Dyken Street station. So you can have flooding in unexpected places, and it's not totally clear from that map that this information was incorporated. And yet I know that New York City went to considerable effort to map the subsurface infrastructure. And I just wonder if that is reflected in the map, so we have a better idea about places that are becoming inaccessible depending on how high
the stormwater scope. And I do think that even though it's not ready yet, it's a mistake to divorce the extreme precipitation, which is more surefire going to happen with any tropical storm kind of event, from just the coastal storm surge, because the coastal storm surge, the exact amount of that can vary quite a lot depending on which part of the tidal cycle you're in as the storm comes on shore. So it's really quite important to get all those local low-lying places and have that really sorted out in a clear messaging way, so that, you know, if you should have a single thing, not tell people like, oh, here's your extreme rainfall thing and here's your coastal storm surge thing. You should have kind of a unified plan for, you know, low-lying areas. It doesn't matter if you're getting it from rainwater coming down or from, you know, the river waters coming up. Low-lying areas need to seek shelter, and the messaging for that needs to be super clear, and it needs to be super streamlined so we don't have fatalities the next time we get an extreme rainfall or a tropical storm event in New York. Thanks.
Thank you, Allegra. You're totally right. I should be clear about the tropical storm because obviously, and hurricanes, you know, totally different. I appreciate your comment about that. As per the residential.
Not tropical storm.
No,
Look,
no,
these storms can happen in December. They can happen in December. They're mid-latitude in nature. They're not tropical storms.
Again, I'm acknowledging that what you said, that I should be more clear about the way I express myself. With that in mind, what I wanted to do, a couple of things that you share. You know, it's very interesting how emergency management is a coordinating agency, but we do have different departments that oversee different areas. For instance, DEP do track, you know, a lot of the amount of water that comes in for just rain per se. And I understand your frustrations of why there is a flood map and then you have a hurricane evacuation, so evacuation map, when it should be all one together. The city does work very assiduously. There's different agencies that oversee things for the purpose of the way that the agency was created is to coordinate. We don't tell DEP how to do the job. We don't tell DOHMH how to do their job. So I understand your frustration about why there's two different things and they're not just ones. Unfortunately, that's not the way the city was designed, but I will take your comment back to our GIS folks who are the one that look constantly at the different data and, you know, and let them know that, you know, for the sake of, you know, of your comment, to make sure that it's reflected that, you know, it is kind of misleading to have two different things instead of just having one thing that reflect both on one. I'll definitely bring back to my agency. As far as, you know, bringing residentials and having more people living in one particular area, unfortunately, the city is very interesting place to live. You know, it's different than any other state for sure. And, you know, my agency cannot stop people from coming into different communities and having high-rise building and all of that. But what we can do is we can plan in advance based on what the number of people that we know live in that particular community to make sure that we're providing services and that we're bringing out everything that we can to ensure that people are protected. And, you know, a lot of our plans, you know, we look at it and we try to work differently because I know communities are different. And we work really hard to ensure that each community has what they need. I understand that sometimes it's not what the public expect, but we work really hard to take comments like yours, bring it back and see how we can improve certain things. As far as the MTA, if it's reflected on the map or not, whether or not the A train is considered an area that is flooding, I will have to look at that and get back to the committee on that, because like I said, I look at the map certain areas. I didn't take a look hardly at the 207 station to see whether or not it's in there. But all I can say is if it is, whether it's not, MTA needs to make sure that they take precaution measures to ensure that they protect their infrastructure. And when I'm talking about MTA, we have different agencies that have facility within Community Board 12. They're all mandated to ensure that they have a plan, not only in case their staff is not able to go back and work there. They should have a coup plan, continuity operation plan. In addition to that, they should be taking precaution and measures to protect their infrastructure. So that's basically just to respond to your questions. Anybody else?
You didn't address the traffic. My concern was about the traffic, not the rezoning is happening, but mitigating against traffic jams when people are trying to evacuate, that is something you could plan for, but I didn't hear you. Maybe I didn't communicate clearly. In addition to the normal like level D traffic stop at 207th and 9th Avenue, there will be an additional 2,000 people evacuating from just a single building, and perhaps catty corner to that, another 2,000 people trying to evacuate along streets that on their best of days have horrible traffic. Is there a plan in place to make sure that those routes stay available for emergency services and for people trying to seek higher ground?
Yes, there is a plan in place. I cannot share a lot of the details, but we work with the different NYPD in different areas to make sure that if we have to evacuate and there's areas that need to be blocked out, traffic needs to be redirected, we work with NYPD. That's as much as I can share with that plan. Hopefully I answer all your questions, the four of them.
All right, very good. All right, thank you, Yogarina. Thank you, Allegra. And I'm sure we're going to have further discussion on this issue as time goes on. Thank you, Yogarina, for taking the time to help elucidate the subject for us.
It's
And,
our
all right. Want to move on now to the next section of our meeting. Updates on COVID-19, the pandemic as it affects our community. We're joined by
Steve,
Yes?
I'm sorry to interrupt you. Is now an okay time to have a point of personal privilege, if you don't mind,
you
before we go to the next segment?
You have a point of personal privilege?
I do.
Uh,
Is that okay? It won't take long.
Okay.
As you know, I'm no longer on the committee, but I wanted to just say thank you for what, 5.5 years of doing this now?
Oh, I think you're out of order. But Darrell, we're going to miss you.
Well, I'm going to miss you all. I'm sure I'll be back. There are other issues to tackle, but we
Okay.
worked a lot on like HIV/AIDS and LGBT health,
Right.
Healthcare Heroes Way, which is very exciting. And yeah, not that I don't want to stick around for the rest of the meeting, but
that does
but
appear to
I'm
be
not.
the case, but you're not. So
But I'm not.
you certainly
And to the new committee members, Steve will grow on you, I promise.
okay. Well, thank you for that endorsement. But you certainly had a lot of influence and good input on this committee over the years, and I think a lot of our work was improved by having that input. So want to thank you for that.
Well, thank you.
All right.
Thanks, Darrell.
Thank you all.
All right. So I would like to now introduce Professor Jeffrey Shaman. I hope I'm pronouncing his name correctly. Maybe it's Shaman. He's a professor of environmental health services and the director of the climate and health program at the Mailman School of Public Health. And I'm very pleased that he was able to join us on pretty short notice. And I was particularly anxious to have him come and speak to us because of a study that he and his colleagues recently issued, which concluded that 103 million Americans, who are 31% of our overall population, had been infected by COVID-19 as of last December, and that the rate of infection in New York City at that time was even higher at 44%, which is pretty damn scary. So I'm wondering if there was any way in which he was able to actually compile statistics, bringing it down to our community level in Washington Heights and Inwood, if that was at all possible. So Professor, thank you so much for joining us.
My pleasure, Steve. I can give you just a little bit of background on this, then talk maybe about some of the implications for Washington Heights specifically. So the central issue here is something that most of you are probably familiar with, which is that there are many infections, there are many more infections from the SARS-CoV-2 virus, which is the causative agent of COVID-19. There are many more infections that occur than are actually documented as cases. Many people who get the virus will have mild symptoms or no symptoms at all, or will simply choose not to seek medical treatment. And if you don't seek medical treatment and you're not swabbed and tested, it can't be recorded by the medical and public health establishment to know that in fact you had an infection. So the cases represent only really a subset of the total number of infections that are out there. It turns out that it's actually quite variable when you go from country to country and place to place. What fraction of all infections are reported as cases? When the United States started out with this virus early on in March, we were capturing less than 1 in 10 infections total, we estimate. And we can see this from mathematical models that used to estimate it, and also some sero surveys when they started to come on a little bit later on. Part of that was reflected by the fact that early on, there wasn't a lot of testing availability. There was only one test that was going to come out through the CDC. There were some problems with it, and it wasn't broadly available to the community. So it kind of makes sense that a lot of people had it and they thought, oh, I got the flu or I got this, and they never really got tested. They were never confirmed as having COVID-19. When we look at places around the world, places like India or some of the areas of sub-Saharan Africa where the medical and public health infrastructure is not well developed, unfortunately, there is an inability because of the lacking of testing facility to document many of the infections that are taking place there. So when we see a certain number of cases in a place like Zambia, we know that there are probably many more infections than you see in the United States. Now, over time in the United States during 2020, we did get better at capturing it. More tests were available, rapid tests were made readily available, free PCR testing, et cetera. And so what happened is by the end of the year, about 1 in every 4 infections instead of 1 in every 10 was actually being documented. But it's still less than half. It still means that a good portion of people were getting infected with this virus, but not knowing it or not knowing it enough that they bothered to get tested and letting public health authorities know it passively in that way. Consequence is that when we look at estimates and we do these model estimates to try to estimate what the total was, at the end of 2020, we estimate just a little under 100 million Americans had been infected with SARS-CoV-2 by the end of the year. Now, only a portion of that, 1 in about 4.6, had actually been a confirmed case. So we're seeing many more infections. Now, in some sense, one might think at first blush that perhaps that's a good thing, right? Because what most of those infections that are undocumented are, they constitute people whose infections in most cases are mild. They're not winding up in the hospital. If they wound up in the hospital, they would have been tested and confirmed as having COVID-19. And so in some sense, it would be fantastic if it was a really large number and if people couldn't be repeatedly infected. Unfortunately, it wasn't a really huge number. By the end of the year, there were still 230 million Americans who had yet to be infected with the virus. And unfortunately, as we've seen with the Delta variant of late, is that it is capable of repeat and breakthrough infections. Repeat being somebody who's already been infected, getting infected again, and a breakthrough infection being that somebody who's been vaccinated is infected in spite of their vaccination. So unfortunately, this virus is not like measles or chicken pox, where you're kind of one and done. You get it once and it confers lifelong what's called sterilizing immunity. So you don't get the virus again. Unfortunately, this virus is much more like influenza, where you can get it repeatedly throughout your lifetime, because either the immunity that your body develops in response to it is not robust and long lasting, and or the virus itself changes. Now we know the latter happens. We know the virus is changing. We just don't know the longevity of that immunity and how well it can stay on target. It's clearly evident that repeat infections, unfortunately, are happening. So there's already some of this breakthrough and repeat infection. All right, so where does that leave us? If we look at maps for New York City, when we did this study, we did it at county scale. So we treat all of Manhattan as one entity, all of Kings County, Queens, Richmond, the Bronx. We also have all the other counties in the United States in it. We did an aggregated assessment simultaneously of all of them, but we didn't break it down to subscales. So to get down to the neighborhood scale, we really need to look at some of the data that comes out of New York City, things that's published on their website, on seropositive rates, on infection rates, on positivity rates. The New York Times posts cases per capita on a weekly rate or a biweekly rate, I think. It's that kind of information that gives us a sense of what's going on in a given locality. I think when you look at that, overall at this point, you know, the area that is Upper Manhattan and Washington Heights is not by most metrics, as bad as many other localities in New York City. It's kind of middle of the pack with some hot spots right up there in Inwood, I would say, where it might be trending. It might be higher. It's not trending as in going up, but even higher than it was before. So what we're seeing is clear evidence of the presence of the virus right now. I imagine many of you are already aware of this. I imagine many of you know people who've been vaccinated and have had infections regardless since that over the last few months. I certainly know plenty. And what we're seeing is evidence that we're going to be dealing with this virus for quite some time. Our projections as to where the virus is going right now with this Delta explosion that we experienced is that we are, last week, we think was probably the peak for the nation as a whole. Now, the Northeast in some areas like Chicago, if you happen to be going there, that is still going up in some spots. Areas in the South that were hit harder earlier have already been going down. And I think the question is what's going on in New York City. New York City has had a decreasing trend. When I look at the data from what I see from New York City Department of Health and Mental Hygiene, it suggests that Northern Manhattan is moving in the right direction in a decreasing trend, but there are still some indicators that it's higher than what we would like to see. The real question, of course, then beyond that is, well, what's the end game of this, right? Where are we going to be done with this? When are we going to get to that post-pandemic phase? And I think the answer is, unfortunately, that there is really no clear delineation of that. I think for each of us, we have our own comfort level. For some people, this was incredibly disruptive and concerning. Other people, they really haven't given it too much thought, really. It's just another thing out there that they don't concern themselves with. But I think what's going to happen when we stop hearing about this so much is it's going to be a very gradual process, and we're going to be able to look back and go, you know, it was right around then by those metrics, X, Y, and Z, whatever they are, that we think the pandemic really ended. And we moved into a new phase, which was endemicity, where many people, almost everybody in the United States, had either been infected with the virus or vaccinated or both. And hopefully that prior exposure conferred some partial protection so that their chance of winding up in the hospital with a subsequent infection a year or two later was greatly reduced. And that's the endemic phase I think we're headed for with this virus right now. So I tend to profess a little bit, it's in my title. I'm happy to take questions. And if I've gone off the topic that you specifically wanted me to address, I'm happy to be directed there as well.
No, you're on the topic. But what I would like to do is, and maybe I should have, I usually give a report of the latest COVID statistics for our community, because I look at the DOH website before all of my meetings to give people an update. And back in June, our positivity rates were running under 1%. All four of our zip codes were under 1%. Zip code 34, in fact, was in the best shape at 0.16, and zip code 32 was at 0.81. Today, we're significantly higher. Zip code 34 is running at 4.24%. Zip code 40 at 3.41. Zip code 32 at 2.61. Zip code 33 at 2.25. And since the last time I gave a report to the community board at our general meeting in June, another 27 people have died in our community. We're up to 690 people who have died, 18,908 cases, an increase of 525 since the end of June. And our vaccination rates are lagging behind the rest of the city and certainly the rest of Manhattan. Our four zip codes, adults that have had at least one dose, we're running between 61 and 65%. 65% zip code 32. Zip code 34 is just under 61%, whereas the city as a whole is at 67, Manhattan at 77. And for fully vaccinated adults, we're all four zip codes are in the 50s. Zip code 34 at 54.51, zip code 40, 57.09, 32 is at 58.29, 33 is at 56.31, and the rest of the city is at 60%. and Manhattan as a whole is at 70. So we're going to hear shortly from a couple of people who have been trying as hard as they can to increase the vaccination rate in our community, and I certainly commend them for their work. But we obviously need to do more. But Professor, you're right, though. When I look at the ranking of our 4 zip codes over the course of the last year, there are 177 zip codes in New York City, and for the most part, all 4 of our zip codes are somewhere in the middle. You know, once in a while, one of our zip codes rises up into maybe the 20s, but for the most part, they've all been down in the in the 70s, 80s, 90s, over 100. So there were places in Queens and Staten Island that are in much worse shape than we are. And the Bronx, but still, it's a little it's discomforting to see that I guess because of the Delta variant, and our positivity rates have increased significantly over the summer.
Yeah, and unfortunately, that's exactly right. I mean, the Delta variant is much more aggressive. It's more transmissible, meaning that the average person who's infected with it is on average going to spread it to more people than the ancestral lineage that first emerged last year, late 2019, really. And it is more capable of causing these repeat infections, of evading pre-existing immunity and infecting a person a second time. I think it's important, when you made the comparison to June, early June, it's really important to recognize that right now, overall case levels are 10 times what they were in June in New York City. Back in June, it was 150 to 200 cases on average per day. And right now we're between 1,500 and 2,000. Though we're trending the right way as a city overall. So it's 10 times that level. Yet the positivity is not quite 10 times that level.
No.
Now, why? Which is interesting in and of itself. The percent positivity is always a tricky number because it depends on the propensity of people to be tested, and my sense was that has fluctuated, and the availability of testing has certainly fluctuated. Late last year in 2020, there was a lot of testing available freely. It seemed on almost every corner, and people could access it, and there weren't concerns about cost. Now, obviously, some people took advantage of that. Others didn't really want to bother. But I think it has tightened up a little bit of recent. I think it's maybe in the last month or two, it's opened up again because of the surge in the city. And so my point with this is that you have to look at that percent positivity as one of many metrics. So the fact that we have 10 times as many cases, yet the percent positivity is only up by a factor of 4, roughly, let's say.
Well,
it's hard to make heads or tails of that.
Yeah. I would also say that people such as myself, once vaccinated, felt less inclined to be tested. We didn't feel as though it was so important. Before I was vaccinated, it was very important. I had to run out every 2 weeks or so, had to try to get tested. Not so much at this point.
I totally agree with that rationale, by the way. And that actually resulted, when we've looked at estimates, we've realized it's a much more complicated picture to model what's going on now with the vaccination going on and all the different variants that are there. But in May and June, we really got the sense, and we estimated it crudely, that there was less reporting of infections. Remember, I said it was 1 in 4 at the end of 2020. It went down again. It was more like 1 in 5, 1 in 6. And I think it was for that very reason you talk about, that some people who are vaccinated were less likely to get tested because they figure, all right, I'm done with this.
How do you manage to calculate the number of people infected who have not reported it? I mean, who have not actually been found? How do you come up with that number? How do you calculate sort of the unknown?
Well, it's called an inference problem, and what we use is a mathematical model that describes the propagation of the virus through all the communities in the United States. It has travel, it has the transmission of virus from person to person and the movement of people between counties, and it also we couple that model with what's called an inference algorithm, which allows us to suck in observations of cases each day in each county. And it then becomes an estimation problem to try to estimate what is the best solution over time in each county that represents the total transmission burden and everything else that's there. And so it's the same way that if you had a partial piece of information about something, not quite, like the 5 blind men and the elephant, but you want to piece it together and get as much information and then infer what is unknown. And it's sort of a standard problem that's used in weather prediction, how you situate a weather model before you make a weather forecast. It's used in engineering and optimization design, like the Mars rover, when it's building a picture of what's out there in front of it, it does the exact same thing. And it's this kind of inference that we do. Now, you could say, well, then how do you know if you're right or not? And the answer there is that we have to confirm the model in a controlled setting where we know the answer that's idealized, and we have to take data that we didn't use with the model, and we have to compare it. In this case, we do have seropositivity assays that were done, where different counties or states or cities conducted those seroassays where they look for antibodies against this virus, which are indicative of people who've been infected. And if it worked perfectly, if it captures everyone, and it's a good sample, it should tell you everybody who'd been infected in that location up until that point. It doesn't work perfectly. And we know there's underreporting, and we know the antibodies wane a bit. But when we compare to those imperfect data and adjust for what we know are the processes of that waning, we get a really good match. So what that's called is an out of sample validation. When we estimate the number of infections in Kansas in the month of August, it compares with the antibody rates that are there. When we do that for the city of Chicago in June and July, it matches with those. So we're able to put it together from the limited pieces of information that we have at the time, conduct the inference, and then compare some of the essential estimates to information we never used when making that inference in the first place. So it's an involved process. It's something that we do. And it's, when you've heard about things like R naught, that is an inference process. We infer what R naught is, and that's another parameter or characteristic we estimate about the virus. We estimate the infection fatality rate. We estimate the susceptibility, and we also estimate how many people really were infected in this instance.
All right, thank you. OC, you have a question?
Yes, I do. Thank you so much, Dr. Shaman. My question is, I heard, I think from an Israeli source, that there is another South African variant that is more violent than the Delta variant. And I wonder if you heard anything about that, and what do we know about it? Is it's in the US or not? And my other question would be, how would the data be different if all the people that are eligible to be vaccinated would be vaccinated and be tested as well at the same time? What would you see differently in your data in that? And I know it's a hypothetical thing, we can't have that, right? But just from
well, just to take the second one, OC, first, it really wouldn't differentiate it much. So like the estimate that we made to the end of 2020, that really predated the effect of any vaccines, because the vaccines weren't rolled out till December 14th, and it takes a couple of weeks before you start to develop any protection. And the reason we specifically stopped there was to avoid the issues associated with vaccination, which are complicating, because some people have never been infected and get vaccinated. Some people have been infected and get vaccinated. It makes it a complicating issue. But we still have been doing it since then. We just know that it's a lot harder problem because of that additional uncertainty. But what you're proposing, in some sense, if everybody were to get vaccinated, taking that portion first, that would just be a different set of conditions, as opposed to having whatever the number is right now in the US. I don't have it off the top of my head, or whatever it is for each county. So that's something that we could handle as best we can. All right. I'm not saying perfectly, but we could. If people were tested regularly, this would be very different, though. If everybody got tested, every day, let's say, the fantasy that I have as somebody who works on infectious disease epidemiology is that everybody will get up one day, be able to breathe into their phone, and it will tell them what they have, right? And I get, if I take the fantasy another 20 years into the future, it then squirts a therapeutic in their face and they're cured. That's sort of like the science fiction future that you might aspire to. Now, in the absence of that, if we had everybody getting swabbed all the time, and those tests were accurate, within the limits of those accuracy of those tests, we would have all the information you say. You wouldn't need to run the inference that my model does. But if you could only test them every week, that's unfortunately not frequent enough. And you're still going to miss some people who are getting infected because you're just not going to catch them when they're shedding enough virus that you're going to detect them correctly. If you make it less frequent and you have less few in some of the population not getting tested at all, then it becomes the problem that we were dealing with there. Then for the other question that you asked about, I haven't specifically heard of the South African new variant. There are lots of variants that are cropping up all the time, and we have to keep an eye on them. There's a mu variant you might have heard about that's from the country of Colombia that is concerning to some. It's been in the country here in the US for quite some time, and it's not in our country competing very well with Delta. Delta has just wiped almost everything else out because it's so much more transmissible and it's capable of infecting people that other viruses can't because they've been vaccinated or previously infected. Delta, unfortunately, has properties that are allowing it to really succeed in the United States right now. And it's doing it. 99% of all sequenced infections are the Delta variant, and it's been that way now for a couple months. So until something is capable of knocking that virus off its perch, it is going to continue to follow through with what it's doing right now, which is going to continue to burn out. Now, the question is, of course, what's going to happen? Are we going to just die off and it's going to go to low levels and we're going to have a relatively quiet winter with respect to the coronavirus? Or is it going to have another surge? Or is something like that South African variant going to come in? The Delta is going to have infected everyone. It's not going to be able to infect others again. And some new variant like the South African one you're talking about comes in and takes over, and we repeat the process again. The end game of this, if you had asked me, people did ask me, and I said, 20 months ago, 18 months ago, I would say that, if I had to guess what's going to happen with this virus, because it's a coronavirus and we have all these other coronaviruses that infect humans, and we get them all the time. People get multiple infections from those coronaviruses within a single year. That this virus is going to stay with us. It's going to be part of the landscape of respiratory illnesses that we're subject to, and people are going to be infected repeatedly with it. What we don't know is how often. Is it going to be every year, or every 2 years, or every 5 years? And what we also don't know is how severe are those infections going to be after the first infection or vaccination? Is there going to be some partial protection that makes it much less likely that we wind up in the hospital with severe, critical, or fatal disease? And in doing so, does it make it so that the infection fatality rate is much more like maybe influenza H1N1, or if we're really lucky, like those other coronaviruses, which are typically very mild? We would probably be able to live with that. And we'd certainly be able to live with that, I would say, because that means it's not as disruptive. Now, the nightmare scenario, which doesn't appear to have manifested, that fortunately, is that doesn't happen and it stays just as virulent and it makes people just as sick, even if they've been infected with another variant previously. Fortunately, that doesn't seem to be the case. We're seeing these breakthrough infections, but they're much less likely to wind up in the hospital.
All right, well, thank you. I don't see any other questions. Professor, thank you so much for joining us, and hopefully you'll come back and as you continue to do your research and let us know what you're up to, and as soon as you further develop that invention with the phone that you can breathe into and it gives you that spray, I'm going to go. I suggest you go out right away and patent that. But I think we're going to want to hear how that thing is coming along.
I'll be sure to come back and let you know about that one for certain. Thanks for having me. Everyone be well. Take care.
All right. Take it. Thank you so much. Ross, are you with us?
Yes, I am.
Oh, wonderful. Ross Fromer is with us. He still has the Archie Bunker easy chair in the back there.
Yes, yes.
And Ross, thank you for arranging to have Professor. How do you pronounce his last name?
I've always pronounced it Shaman, but Shaman, Shaman, he answers to both.
It's
Yeah,
Shaman. I answer to Shaman. Thank
okay.
you.
Shaman. He's still with us. All right. I'm sorry if I mispronounced your name earlier. Ross, you have a report to give us?
Sure. And first, I also want to thank Dr. Shaman for joining us. Jeff, always a pleasure to work with you. I have a couple of things to go over, just a couple of updates. The first is at the medical center, we continue our testing program. This data is always on the Columbia University website. I'll just report that for the week of August 30th, we conducted 3,149 tests, and apparently we had 3 positive results. So the data from the most recent week is as good as we could hope it could be. We are also in the midst of implementing our vaccine requirement for employees, faculty, staff, and students. It was a process which started over the summer. Basically, the drop dead date, that's a bad analogy, sorry. The real sort of hard deadline was, in fact, I think it was yesterday, maybe today. I can report that the number of employees at CUIMC who are out of compliance is somewhere below 20 out of about 12,000.
Wow.
Yeah, now, just to be clear, you can be in compliance for 3 ways. You can get the vaccine, you can get a medical exemption, or you can get a religious exemption. I can tell you, without getting specific numbers, that the large majority of the people who are in compliance have gotten the vaccine. There is a small number of folks who have gotten a religious exemption. There is a small number of folks who've gotten a medical exemption, and then the overall majority of our employees, students, and staff have gotten the vaccine. And then, like I said, about 15 folks or so are currently out of compliance.
And what was the total again? 12,000?
I think that's the number, but let me go back and check the exact amount, because
Okay.
we're counting full-time employees, we're counting students, we're counting part-time employees, we're counting contractors. So I don't want to. The number is high, and fortunately, because we've done a lot of work, the numerator is very low at this point.
Very good.
One complicating factor, and we're dealing with this, is that when we set this policy out at the beginning of the summer, religious exemptions were part of that policy. As you may realize, last week, the state implemented a policy for healthcare workers. There are no more religious exemptions. So we're in the process of having to revoke the exemptions that we for some of them. Now, for folks down in Morningside, for folks not involved in healthcare, this may not be an issue, but for healthcare workers, the religious exemption per the state is no longer available. Again, that was very, very small numbers, and we had a very, very rigorous process for granting the religious exemption. Moving on, just a couple of updates in leadership at the university and at the medical center. Many of you may have, over the time, either through these meetings or through Project Medical Education, met Dr. Dennis Mitchell, professor at the College of Dental Medicine. He is now the Executive Vice President for University Life for the entire university. He replaces Suzanne Goldberg, who went to work in the Biden administration. He will also continue on his role as Senior Vice President for Faculty Advancement and continue also to hold the role in the College of Dental Medicine. We have a new provost, Dr. Mary Boyce, who is the former dean of the Fu Foundation School of Engineering and Applied Sciences. She is now the provost, and Shifu Chang is now the interim dean at engineering. Dr. Monica Lipsum is now our new vice dean for medical education at VPNS. And Dr. Jeanette Wing was appointed executive vice president for research for the entire university. We also have a new dean of professional studies, Dr. Troy Eggers. Some very exciting news, which we just announced earlier today. We have received a $10 million grant from Pfizer over 3 years to expand diversity in clinical trials and to expand the diversity of the research workforce. So a number of programs that we'll be doing to try to make clinical trials more diverse and also the workforce working on that.
This is so important. Really want to hear more about this next month. This is very important.
Yeah, so there's a lot going on here. Dr. Lantigua is working on a number of things. Steve, I can forward you the link to the press release. It's on the website as of now, but I couldn't agree with you more in terms of the importance of diversity in clinical trials. One of the great advantages, and frankly, I'll be honest with you, a competitive advantage that we as Columbia have over other great medical schools across the country is that because of where we're located, we work with a much more diverse population. And I'll be honest with you, it's just good for research, and it's good for the outcomes of research. Columbia is going to have a football season this year. We did not last year. And that means we are doing a Northern Manhattan Neighbors Appreciation Day. In fact, we'll be doing 2 of them. Now, this is going to be obviously a much more scaled back version than the ones we've done in the past. But for our first 2 football games of the season, which is November 18th against Marist and November 25th against Georgetown, we will be offering free tickets to all residents of Northern Manhattan. One thing important to know, only vaccinated people 12 and over. For everybody 12 and over, you must be vaccinated to attend, and please bring proof of your vaccination, whether it's the actual card or your Excelsior pass. We will not let you in the game if you're over 12 and not vaccinated. Furthermore, all attendees must be masked the entire game, both indoors and out. So I encourage those who want to attend to come and see us on the 18th and or the 25th for the Columbia football game. We're very excited to have our first sort of, and it's a small version, sort of movie night in Haven Plaza, but it's actually tomorrow night at 7 p.m. We'll be screening a new comedy web series called Gross Anatomy, which is actually directed by a native Washington Heights resident, Adrian Miranda. This screening is free and open to the public, and it's at 7 p.m. tomorrow night in Haven Plaza.
His last name is Miranda?
It is Miranda. I asked, not related.
Oh, okay. All right.
It's just we all have the same question.
Okay.
2 more things that I promise all done. Our SPrep program is open for application. This is a enrichment program for high school and college students who are interested in the sciences. The deadline to apply is, I guess, it's coming Wednesday, the 15th. More information is available on the website, and the link will be in my report. And then finally, a Velocity ride is October 3rd, 2020. Velocity is Columbia's ride to end cancer. This is something that we did in person in 2017, 18, and 19, have raised millions of dollars for cancer research on this. In 2020, we did it virtually, and in 2021, we are also doing it virtually. And that just means that if you sign up on that day or someday around it, you ride whatever length of bicycle ride you want to do, and you use that as method to raise money for cancer research. We want to encourage more and more community residents to participate. As such, we have a special code for Washington Heights residents who want to participate that'll waive the registration fee. To be clear, it will not waive the fundraising minimums. No, we don't waive the fundraising minimums for anybody. They don't get raised for me. They don't get raised for the dean, nobody, but we can waive the registration fee. I'm going to trust everybody here to share this only with Washington Heights residents, but it'll also be printed in the flyer, but it's basically, as I understand it, WAHI 21, WAHI 21. So those who are interested, who like to bike, who want to raise money to help support cancer research, we encourage you to join us. And hopefully next year we'll be back in person for Velocity. We start, it's 10 miles, 25, 45, or for the real biker, the real serious bikers like my brother, 65. We start up in northern Jersey and in Rockland County and work our way all down over the George Washington Bridge and into Washington Heights and finish at the medical center. I can tell you, having done it 3 times, the Palisades earn their nickname. The Palisades earn their name. They are a challenge to get over, but I did it. So again, looking forward to doing it again next year. And with that, I am, first of all, I want to thank Janelle Edwards from my office, who just basically prepared everything for me to do. She always does a great job, and just happy to take any questions.
All right, do I see any hands? Don't see any. It looks like you satisfactorily covered everything, Ross. So I appreciate your joining us tonight.
Thank you.
And next month we'll hear all about the bike ride and where you actually chose to ride the bike this time.
Okay.
Now,
and Steve, I'm happy to talk to someone about getting sort of a more information about the new Pfizer grant.
Absolutely.
We'll come with an update next month.
Absolutely. Oh, one second. I think we do have a question, but you know, it's been an interest of this committee for years to try to make sure that the clinical research program at the university has a broader reach, and that more people from the community are aware of it and are not only enlisted to participate, but also have the opportunity to find out the results of what they contributed towards and what the findings were of the trials. And actually, we're probably overdue in inviting back. I forget her name. I don't even know if she's still running the IRBs, but we probably should invite
Brenda. Brenda.
Right, Brent. Yeah,
Yes.
probably should invite her back. But I'm definitely interested, and I'm sure my other committee members are interested in hearing more about the Pfizer grant program. Mr. Crenshaw, do you have a question?
I actually have to let you know Dodie is here and she has a question.
Ebenezer, can you promote Dodie Dohoney, Dohoney?
I got you, Steve. Ebenezer's having, oh, he's here. He had some internet issues.
What is that?
That Ebenezer was having some internet issues, so allowed to talk, and Dodie should be, if Dodie unmutes, she should be able to.
Okay.
All right, Dodie, you have a question.
There. I can't see anybody else except for like 5 of you, 6 of you. But yes, I do have a question for, is he Dr. Fromer or is it?
No, just Mr. or frankly, just Ross is fine, please.
Okay. So I am an Inwood resident, and I've been trying since April to get a vaccine hub up here in Inwood because the city and the state pretty much turned the other way for people in this neighborhood. And a friend of mine had really brought this to my attention, a neighbor of mine, and had brought it to my attention. And she was out flyering the neighborhood, and together we managed to get a lot more flyers from the city's task force, you know, the test and trace people. And I tried for about 4 straight months to work with one of our politicians, not really one that represents uppermost Manhattan, but he was a health committee chair on the city council, and it never happened. They tried to help me and they responded right away. And then somehow it just all, you know, by the 4th month, it just kind of disappeared. So at this point, I was able about a month and a half ago to find a website. I literally don't know which one it was. And I managed to send an email to this website that had some connection to the vaccine buses. And I managed to get them to come last week up to Inwood for 4 days. It was amazing. We flyered the neighborhood like mad, and we actually reduced the rates of unvaccinated people here by about 3%, a little over 3%. And so we finally got up to 60%, at 60 point something percent, maybe 0.9. And I was just
No,
thrilled.
no, you're not, well, 1 second.
Am I still on?
Yeah,
Can you hear me?
yeah, zip code 34, is it
Yes,
60.78% of adults who
Right.
got one dose, and 54.51% of fully vaccinated adults.
okay, very good, thank you. But at this point, they are going to come back to us in 2 more weeks, again, Monday through Thursday, and exactly at the same spot they were at, which is in the 10034 zip code. And they actually parked on West 207th Street, closer to the #1 train, which is the east side, of Inwood. But-
Dodie, this does not sound like a question for Ross.
Yes, it's getting to be a question.
Uh-oh.
So
Oh, okay.
I know that the numbers are quite bad for 10040, which is Dykeman Street and south, or the south side of Dykeman, south to wherever anybody thinks the border of Inwood is, because it's always up for discussion. But the numbers are bad, almost as bad, actually a little worse than Washington Heights in general. And my next idea was to attempt to reach out to Columbia Presbyterian doctors, people who are Latino, Latina, Spanish speakers, and I would like to invite them on a daily television program on a private, a pay cable station that's a Spanish cable station. I don't even have it myself, so I was on the program a week ago, last Monday, and I wasn't that good, but my Spanish was pretty good. So the question is there someone you can recommend to me who could give me that ability to find Spanish-speaking doctors, Latinos and Latinas, especially like internists, general doctors, who possibly people in our community go to and respect and would trust, because we still have quite a way to climb to get us at least to maybe 70% up here.
So first of all, let me just take a moment and applaud the work that you've done, because, I think anybody, I don't want to be so forward, but I think I'm of the belief that, every shot in the arm is just a step in the right direction. So
I agree.
yeah, and so I'll raise my proverbial clap my proverbial hands for you. The answer to your question is yes. We have several bilingual faculty who have been very active in getting the word out of the vaccine. Dr. Antigua, Dr. Minguez, Julio can probably tell me a couple of more. And it's more so early on, but they're still available. I can't tell you how many media appearances, forums, big and small, that they were doing. Excuse me if I sound a little bit boastful, but we were out there, and we are prepared to continue to be out there, because our faculty sincerely and deeply believe, and excuse me for getting a little bit emotional here or stressful here, that this has to be done. And
Yes.
They want to get as many people as vaccinated as possible. And they strongly believe that, and they want to get that message out. So, you tell me when, where, we'll get someone there.
And can you share, or can Steve share with me your telephone number so I could call you, and I will he's got mine now. So
Yeah.
I'd love to give that to you, because I would like to get internists, now that I'm thinking of it again, internists, gynecologists, obstetricians, because we have had a bunch of pregnant ladies who refused, said, nope, I'm not getting the vaccine. Why not? They said, well, my doctor told me not to. And I'm like, the guidance is completely the opposite right now. And
Right.
pediatricians. So pediatrician, obstetricians,
Right.
and interns.
So Dodie, if you go to www.columbia.edu, there's a university directory, FROMMER, RAF 2002 at columbia.edu. My information's all there, and Steve has it all.
I don't write that fast, Steve.
Dodie, Dodie, I'll give it to you. And Julio Batista, who works directly for the hospital itself, is also a very good contact. And
Wonderful.
And he would probably be very good on the cable show too. But I think maybe now you gave the entire report that I wanted you to give.
Except for the fact that we vaccinated 747 people.
Oh,
A bunch were kids.
right, good.
Thank you.
But by kids,
747, like the plane.
the kids who are 12 or over.
Yes, we, you know, I was specifically really trying to reach out to parents, and I would talk to a lot of teenagers in the neighborhood as we flyered like mad with
Right.
very little advance time before the buses came, like literally 3 days. And we had a bunch of other people who helped us flyer, and we posted the flyers all along 207th Street. So we probably flyered about 400 or 500 people between the eight or nine of us. And I did make sure that I tried to speak to the teenagers and the younger kids, you know, 12 and 13, 14, who might have been with their parents. And I think I gave a little bit of misinformation. I thought New York City was requiring for public school kids to get vaccinated. And then I was disabused of that. But I hope that kind of
I'm
spurred a
sorry,
couple of-
Steve, it's 5 minutes to 9
Yeah.
and we
Yeah,
have
we-
many
yeah,
things on the agenda.
You're right.
I
we
hope
have
it
to
kind
move
of
along.
spurred some of the parents to bring the kids for those 4 days to get vaccinated. I
All right.
just really want the kids to be protected now that they're going back to school.
All right, well,
Thank
thank
you.
you, Dodie, and I join Ross in praising your efforts. Getting
Thank you.
747 people vaccinated in just about a week or 4 days is a fantastic accomplishment.
Thank you.
I want to move along now to Pauline Ferranti from the Department of Health and Mental Hygiene, who is one of our regular guests. Pauline?
Hi, everyone. How are you? So I have some news that close to 5 million people have been fully vaccinated in New York City, which is very exciting. But again, we still have a long way to go. And, you know, in light of the Delta variant, we want to make sure as many people are getting vaccinated as possible. So I applaud Dodie's efforts in getting vaccines to folks in Inwood, since I know that the city was slow going on that, definitely. But I wanted to share that starting September 27th, the city contracted childcare and after school staff will also be required to be vaccinated. And this is consistent with what is existing with DOE staff and their vaccination requirements. So we are trying to make sure that as many people who are able to get vaccinated should be vaccinated. And that's one of the city's ways in which we are trying to ensure that. Starting next week, there will be clinics, vaccine clinics in all school buildings that have students 12 and older. And that's over 700 buildings, which is very, very exciting. And again, to everyone's point, you know, if you are 12 and older and you're able to receive a vaccine, you should be able to do so. And we want to make it as accessible as possible. So those are some of the big news. I mean, you guys knew about the open meeting laws, which I was very excited to report tonight. But the governor did extend virtual meetings to mid-January of next year, I believe January 15th. So that will help hopefully with everyone, commissions, community boards, et cetera, to continue their operations without being forced to meet in person if people are uncomfortable. And then, you know, Key to NYC is ongoing. I believe enforcement begins on Monday. There have been a huge push of education that was happening throughout all the businesses that are required to have folks prove vaccination status. So that's been ongoing. And, you know, we're just excited to have the city continue to open, but we want to make sure it's as safe as possible. And again, we want to make sure that people who are eligible and able to get vaccinated do so. And our main goal is to get that education out there to folks. So if anyone has any questions for me, I'm happy to answer them.
Yeah, two quick ones from me, and then we have a couple of other committee members. Which enforcement begins next week?
The Key to NYC, so all of that indoor entertainment, restaurants, galleries, museums, things like that, anywhere where there is indoor gathering that requires proof of vaccine status, that enforcement will begin next week.
And having the vaccine clinics in 700 school buildings is unbelievable. uh, is this going to be handled by school nurses? And is it limited to only students? Can they bring in their families?
You know, that's a great question. I don't know the answer to that. I will find out. I think it's a collaboration between school nurses and other staff, H&H staff and DOHMH staff, anyone who's eligible to provide vaccines to people who are licensed properly to do so. But I don't know that piece about whether or not family members are also able to. I don't see why not, but I will double check and make sure to get you that answer as soon as possible.
Yeah, I think it would be a great opportunity to expand the reach of our city vaccination efforts. Ms. Fisher, you have a question?
Yeah, but it's not about COVID, it's about pesticides.
Yes.
You guys did a spraying on August 24th with the adulticide.
Yep.
It looks like from your site that you do this when testing is shown a high risk to human health. I wonder what kind of testing was done. It looks like we were the only area in Manhattan that was sprayed. And I'm wondering,
Yeah, so we have a very high threshold for spraying because we do know that people have concerns about pesticides. Just to be clear, the pesticides that we use are approved and do not show or have not shown harm to humans. But again, we do try our best to make sure we notify people so that they can take the proper precautions just to keep their windows closed or to wash anything that has been outdoors. But the pesticides we do use actually die in sunlight, or it disintegrates in sunlight. And so, but again, we have an extremely high threshold of when we do conduct these spray events. And that is only when our pool of mosquito traps show West Nile virus. And that is the only time our teams will go out to conduct a spraying. Any other time, we will not do nuisance spraying. We will not spray for any other reason until our pools detect the prevalence of West Nile virus within the mosquitoes in a particular area.
okay, because we didn't see any of those test results. It would be helpful to actually see the test results. And also the concern was not just for human health, it's also for the health of our wildlife.
Sure, yeah, absolutely. And so for test results, what do you mean?
Yeah, you said that you had, your test showed that there was a high number or high percentage of mosquitoes that showed West Nile. So where is that information so that that can be shared with the community?
Oh, I see. I believe we have information on our West Nile page. I don't know whether or not it breaks down sort of the percentage of mosquitoes. The way that it's tested is that all the mosquitoes that are found in a trap are sort of put into a system where it's kind of a gross process, but they're all mashed up into one big sample, and then we test the sample. And so when there is presence of West Nile disease, that the West Nile virus, that is when we conduct a spray event. So it's detection of West Nile where that in and of itself is very, could potentially be more dangerous to humans, where people get very sick and potentially die from West Nile virus. And that is the only time we would conduct a spray event.
And Pauline, the spraying occurred, if I remember correctly, in the entire northern Manhattan area north of 150th Street. So, does that mean that there were a whole series of such mosquito traps throughout the community where you detected the West Nile virus?
Yes, we only spray where West Nile virus is detected. So we do have multiple traps throughout the city, and we wouldn't do like a blanket spray of a neighborhood without having, confirmation that certain traps in certain areas tested positive for that.
Right, so it's not going to just be one or two, it's going to be a whole series where this became where you detected this.
Right.
All right. Catherine, you have a question.
Yeah. Hey, Pauline. A quick question. Are the COVID trucks still offering the $100 incentive? I had two folks who had trouble accessing the incentives through the trucks. I just wanted to make sure it's still out there.
Yeah, I think the incentives are still ongoing. I don't know specifically how they are doing them on the trucks or the vans or the mobile units, but I know that if you go onto the Vaccine Finder website, it lists which pharmacy or which clinic or whichever participating vaccine site is offering that incentive. So I would just encourage people to get clarity on that prior to going to get your shot, just so you're 100% clear as to what the process is to get that $100, and so there's no confusion around that.
Well, I think one of our next speakers is an expert at helping people get the $100. I'm going to rely upon him to clue us in. But I'm not ready for you yet, Dave. And any other questions for Pauline? No, very good. Thank you for
Allegra has a
Pauline.
question.
Oh, I'm sorry.
Allegra has a question.
Who does?
Allegra.
Okay. Is she still? Did we demote her? What can we bring her back?
Let's bring her back.
Yeah, hold on.
Let
Let
me bring
me.
her back.
Yeah, hold on. Give me a second. Let me just find her.
She's
Hold
back.
on.
Okay, I'm back.
Okay, just when you thought it was safe, Allegra is back.
Okay, I have a question for her. I had a question for Jeff, but that's okay. I'll ask him another time. Three things. One, I've noticed that messaging is very specific about the vaccine mandate for Department of Education employees. I just wanted to check and make sure that includes all related service providers, because as we know, the occupational therapists, the bus drivers, the paraprofessionals, most of those people are not in fact DOE employees. Do they have a vaccine mandate for those people who work with children but are not employed by the city? Second, the mask mandates for schools are very vague, and yet there's been pretty unequivocal studies now. This one coming out of Bangladesh that shows that cloth masks are inferior to surgical masks. So when will the guidance for school masks be updated to reflect a minimum standard of masking? And third, we talked about you monitor for West Nile virus. I wonder if the OHMH has started monitoring for Lyme disease, which we know has been encroaching in a lot of communities, including in Wood Hill Park, and if you have any mitigation strategies for coping with increases in those types of ticks in our communities. Thanks.
Yeah, so the first.
1 second, I have to interrupt.
Sure.
Allegra, you've heard of cases of
Yes.
Lyme disease in Inwood Hill Park?
So Columbia had a few studies where they were dragging those white cloths through various parks around New York City. And there's a particular tick that carries Lyme disease, and they have found that tick and some incidents of Lyme in Inwood Hill Park. And definitely if you go out into the Bronx or in Staten Island, they're finding the right kind of ticks, and they are carrying Lyme disease. I just wonder, are we on top of that kind of thing?
Yeah, I'm
They're
sorry.
definitely finding the right kind of ticks. I mean, I'll dig this research paper up for you, but surely the OHMH is on top of that.
No,
I'll send it to you later.
Yeah, I would appreciate that. Thank you, Allegra.
So for the first two questions, I will reach out to DOE to get further clarification and provide a response to Steve to get back to you. And with regards to Lyme disease, I do know that the mayor's office had a program. The DOHMH does, so in a way, I don't know whether or not there is specific monitoring of Lyme disease in the city. I can definitely check on that. But I do know that when there are reports of it, we do hear about it. But I do know that the city was working, City Hall was working very closely with a, I don't know, like a wildlife company that was sterilizing deer on Staten Island because they were sort of the main carriers of ticks and could potentially, carry Lyme disease throughout Staten Island. I don't know whether or not, I'm not sure what came of that pilot program, which I'm more than happy to find out from City Hall. But I do believe that they did manage to reduce the number of deer on Staten Island, which tangentially helped with the tick situation. But yes, we do provide messaging around ticks, but I don't know whether or not we have very specific tracking mechanisms for Lyme disease.
I just was wondering because, you are, good about the mosquito traps monitoring for West Nile virus, but Lyme disease is prevalent and expanding its reach, quite frankly. And I'm curious why we don't have a regular monitoring program for.
Yeah, that's a great question. I will definitely reach out to our folks here. I know it's been a conversation for a while. I just don't know exactly why or what limitations we have in terms of tracking Lyme disease. So I'm more than happy to get back to you on that.
All right, very good. All right, thank you for the questions, Allegra.
Yes, they're great questions. I have to say, you guys are like the nicest but toughest people, but I have to say your community is so much better for it. I just appreciate you all so much.
Oh my gosh, thank you. You're making us all blush. But I tell you, Pauline, it's wonderful to have you and to have somebody with your spirit and willingness to work with us, and especially willing to hang out for a couple of hours before we give you a chance to speak. Betty, you're all lit up. Why is that? Okay, no question there. All right, Pauline, thank you so much. Next up is Julio Batista from New York Presbyterian Hospital, Government and Community Affairs.
Thank you, Steve, and great to see everyone as well. I have just a brief report. I know there are some concerns around still the numbers of the COVID. Like everybody else throughout the country, during the summer, we did see increase of the Delta variant, which increased the numbers of patients that we saw at the hospital. At present, we have across really 10 campuses, we have roughly about 220 patients that are admitted because of COVID. I'd like to say that our emergency rooms, however, have been very, very busy. And the census have been high the last few months, not only for COVID, but for other health conditions as well. I think that perhaps in the mind of some of the members, let's talk about getting the third booster, getting the third shot, or what they call the booster shot. We continue to follow direction for CDC and of course, New York State on this. At present, there's fairly a narrow group of people with who are immune compromised conditions who can now receive the booster shots. And those are people who are transplant patients with certain undergoing certain cancer treatments. Those are really the ones that designated present. But the federal government has indicated, as you know, the booster shot, the general public is recommended 8 months after you were last vaccinated. So beginning on September 21st, it will be in most of the cases. We're still waiting for the guideline for exactly how that would be rolled out. We're not sure yet. Since one imagines that there's going to be droves of people trying to get their third or booster shot, one would think that that we will use the armory. We have no intentions at this point of opening up the armory for this. As you know that there are a lot of distribution points at this this time where people could get the vaccine. There's adequate supply, so over when we get more details and more information, we will sort of decide how we will roll that out. I'd still like to say that partnership with the North Manhattan Improvement Corporation, the hotline remains up and running. Continues to be a resource for the community. Ask people that they want to get information where they can get vaccinated, schedule an appointment if they need to. They can call the NIMIC hotline, which is 646-838-0319. They can call there. They'll get information about vaccination sites. Again, they need an appointment. They can schedule an appointment through the hotline for that to happen. We continue to promote, have presentations around vaccine hesitation. We know that continues to be a problem. We have, staff and clinicians in multiple languages that are able to make presentations. It doesn't matter how small or how large is the group. We still are offering that, and if you know anyone, please can send that our way, and we would be happy to schedule a presentation for that group. One of the things that has happened is, people got more comfortable, they got vaccinated. There are a lot more activities taking place out in the community. We at the hospital are not participating in outdoor activities or in-person activities at the moment. However, we know that these are taking place, and one of the things that we're doing is, again, if you know any groups that are doing this, we can, are supporting by providing masks, hand sanitizers that they can use at these events to hopefully keep everyone a little bit more safe. So that is, well, one other thing, nothing related to COVID. Just like to say that as all of you watched the news today, the former chair of Community Board 10 was, I guess, the chair about 3 years ago, was just sworn in today as our new lieutenant governor. So from being a chair of Community Board to lieutenant governor in 3 years it's a great thing for the Harlem community. So that's really it, Steve. I'm not sure if anyone have any questions.
Well, let me just confirm. We do have at least 3 questions after me. So you are saying at this point that the hospital is experiencing an increase in the number of COVID patients presenting themselves at the hospital, and is that the rest of my question? Is that particularly true at 168th Street and the Allen Pavilion?
So over the summer, we saw an uptick. Most patients, unvaccinated patients, really it came in with, was detected to be the Delta variant. At present, it's sort of leveling off. It's still high. That 220 represents really our 10 different campuses. I know you're very interested in Columbia, and we have about 50 patients at this campus who are admitted because of COVID.
And does that include Allen?
Yes.
And are you still giving vaccine shots at the Children's Hospital?
Again, we're still vaccinating at the Morgan Stanley Children's Hospital. We're doing that. We, again, utilizing the NIMIC hotline to encourage people to make the appointments if they need to. We still continue to promote that. And let me just also say, thank Dave Crenshaw, because when, we were trying to get the word out last year, the fall last year and winter, Dave and his team were very instrumental in going out in the community and distributing some of the vaccination cards, the hotline information to the businesses and local residents. So I really, publicly want to thank Dave and his team for doing that.
And but going back to Children's Hospital, can people just walk in? Is it open 5 days a week? What are the hours there now?
We're still doing it by appointment. Although if someone shows up, they're not gonna send them away. But we're trying to do this by appointments only. They're open except Sundays. Again, we try to do this by appointment and try to do this through either one of the providers or again through the NIMIC hotline.
Oh God. I'm going to lose power in 10 minutes. All right. Thank you. And Sally, go ahead.
Any update on the Allen Hospital psych unit? Do you have a date for reopening?
No, we, we continue to prioritize, we continue to prioritize, behavioral health. I mean, that's something we continue to do. But at the same time, we want to be flexible for the next or latest surge. So there's no set timeline for us to reopen that unit.
Okay, and how without, just to ask about your response, how without having inpatient psych beds are you exactly prioritizing behavioral health?
Again, I think that the process has not changed at all. If anyone is brought up to the Allen Hospital, the process has always been that that person is stabilized. They are then sent down to 168th Street, where they're further evaluated. And from 168th Street, as always been done, then sent either back to a bed then found from whether they stay at Columbia, at the psych unit at Columbia, or they will be sent out to one of our other behavioral health centers.
And how many of you, do you know what percentage are going to city psych beds?
I'm sorry, I didn't see, Sally. What was that again?
What percentage are going not to New York Presbyterian, but to city psych beds?
I don't have a number. I don't know that we're sending. I mean, we have Gracie Square and also the Westchester, but I don't have any numbers in terms of how many patients are being transferred to those locations.
Thanks.
All right, OC.
Yeah, okay, so my question, I have two actually. One, we would like to get updates on from the anti-discrimination unit or task force, I should say, the hospital put together. They had, I forgot the name of the doctor. They had a presentation like, I want to say 6 months ago or something like that. And we never heard from them since. I mean, well, we had the summer vacation and so forth. So can we get updates from that task force on a regular basis? Do you know which task force I'm talking about, Julio?
Yeah, I'm trying to remember.
OC, if I may, and I apologize for interrupting, but in March of 2021, we had a presentation by Dean Rustigui, Dr. Lantigua, and maybe one other person on the anti-racism task force
That's
on the Columbia side.
Yes, that's
Is
it.
that what you're referring to?
Yes.
Yes. Yes.
Okay. I know that there's a meeting today, so I can't give you an update right now, but happy to invite that crew back at a future date.
Very
Okay,
good.
that will be great. My
Thank you.
second question is, Julio, does the hospital have a trauma unit or trauma bed? Because one of the last shooting we had in Inwood, the patient was sent to Allen Hospital where he died. So I wonder why it was sent to Allen, not to 168 or St. Barnabas. Normally they get sent to St. Barnabas, and I don't really know why. So I need to understand who has trauma bed or trauma unit, which one of the.
Yeah, I mean, Liz, as a hospital, we attend to all conditions, but in terms of being designated as a trauma unit or location, only the Morgan Stanley Children's Hospital for us is designated as a trauma center for pediatrics. Columbia or the Allen is not a designated trauma center by the state. So that's why when there have been some sort of incidents and the patients will end up going to another hospital and question why they didn't come to Columbia or to the Allen is because we're not designated a trauma one center.
One did came to Allen. So my question is so my understanding from this that in our district, we do not have trauma unit anywhere.
Well,
we don't have a designated trauma center.
Not an adult, we have a child.
And I understand the children section. I'm talking about adults that get shot and things like that.
Well, that's why very often you're correct. They'll either go to St. Barnabas or they go to Harlem Hospital. It's I think we've always found this to be very strange that that Presbyterian, a hospital of such a
high number one
adult
in the country,
status.
but don't have a trauma center.
Would not
Yeah.
have managed to.
Can we work on that?
We don't. I mean, it's a fairly, I mean, I think that the question has been raised in the past.
Yeah.
It is a fairly, very extensive process.
Right.
At this time, or at the time it was discussed, there was not something that the hospital wanted to pursue.
But you
We
have
do
trauma center
do-
for the children, so I wonder why not adults, so.
Yeah.
Okay, I think we should discuss about it a little more.
Yes.
Not today, obviously.
Not,
but-
no, but I think it's a very good issue that you bring up. And then it's bugged me for years. We should pursue it. Jay, you have a question? Mr. Mazer?
So I just would like to iterate, Steve, why Jay gets online, is that we encourage everyone to help us promote the. Go ahead, Jay. I'm sorry.
Jay, you unmuted yourself.
I'm unmuting.
You're going back and forth.
Am I now unmuted?
Yes.
You're unmuted. Yes, we can hear you.
Yeah, it's kind of unrelated to the previous questions. I don't recall, you may have answered this before. Has the hospital posted the price for services?
If you go online to a website, you should be able to get that. Yes.
Okay, good. Thank you.
Okay. Julio, you had some other comment to make?
No, just wanted to reiterate that, the fact that, our numbers are up here lower, as it was mentioned before. Whatever we can do in terms of getting, folks out there to discuss the issue of hesitation. We have a number of doctors who have gone and spoken about the vaccine, the safety, if you're pregnant, whatever it is, we're available to do that. We'll be more happy to do that again. Public events, the Delta is still spreading. If you need, someone who's having an event, needs masks, needs hand sanitizers, let me know, so that we could hopefully keep some of those people safe as well.
Well, I tell you, I would, you're going to lose me in about 2 minutes, but I'll Betty, you're going to have to run the meeting and I'll then come back. But I would just urge the hospital to consider either reopening the armory or doing something comparable, because there is going to be a huge demand for the booster shots or the third shots in the very near future. And the people who got the first 2 shots from you are going to expect to get the third shot. And we don't have, as Dodie Mahoney pointed out, we don't have facilities in Washington Heights and Inwood that can really handle that kind of a demand. At this point, all we have are the drugstores and the occasional mobile vans and buses. So Dave Crenshaw is next. I would like him to discuss his efforts, but Julio, I wish you would take it back that we really are counting on the hospital to do a major effort to provide the booster shots in the very near future.
Sure.
Dave, go ahead.
I'm going to say good night, folks. Have a good night.
All right, thank you, Ross.
Good night.
Good evening, everyone. Dave Crenshaw here from the National Black Leadership Commission on Health. I know it's not my usual title and role that you'll expect to see, but I've been working with this group with Virginia Fields. She's our president. And what we do is we try to go into communities that get left out and make sure they're taken care of. We started off by giving out masks. When no one had access to masks, we made sure folks had masks. Then we went into COVID tested, and now we're on the vaccines. And to make what Black Health does is they partner with local small CBOs to reach people in the community that are normally not reached. They don't normally partner with the large agencies. They partner with small groups who know how to reach the little knickknacks in their communities that other folks don't reach. We got associated with them because we work with the food pantry at Cloth. And Miss Yvonne had 200, 300 people stand in line every day that we were able to give out masks, able to give out information, able to sign people up for tests. Now, we're talking about the vaccine, but the COVID testing is where we learned what we had to do. We learned how to do outreach. We learned how to engage people and not just give out literature. Some folks give out literature, but we give out information and we like to talk to people. And the key is, as Steve has mentioned, is I'm never by myself. I always have a team with me of interns and apprentices who are either in public health or they're community coaches that want to improve their community. And one of the biggest things I learned is that you always have to have Spanish speakers with you. Just because someone is Spanish does not mean they speak Spanish well. So whenever we go out in the streets, whether it's Washington Heights, Brooklyn, or the Polo Grounds, we make sure we have people who can speak the language so that we can reach people. And what we specialize in is getting these vaccine vans. People want to know, how do we get them? Well, we start off by, we help anyone who has a van. What good is a van if people don't know where it's at? So a lot of times the vans are in the neighborhoods and the own neighborhood doesn't know. So we make sure we do outreach at subway stations, special corners, and direct people to the vans. We make sure we let them know that this is the van is operating and what time it's operating. Then we started doing so well, the numbers started going up at the vans that we helped. Then we got offered a van. And here's the key to getting another van. You gotta make sure you use up all the doses. You understand? Because the city doesn't think you can use all the doses they give you. So we haven't done 800 people, but every van that we use ran out. Every van that we use at the Cloth had a van at their block party, it ran out. School in the Square had a van, it ran out. We've had a couple of vans on 164th Street, they've all run out. And at Coogan's, we had a 2-hour wait at Coogan's for people just to get the vaccine. The line was so long, we had to send people to another site. And that's what we're gonna do. We're committed to making sure people get the vaccine. If we have to put you in a cab to send you to another site, we will do that. If we have to take your name and number down and contact you another day, we will do that. So one of our practices, what we do is we have our own number just for people to text us for information. If they want to know where the van is any day of the week, they can contact me. The same way some of you know, when the Armory was open, I was at the Armory every morning just to find out if they was taking walk-ins. And then I will come back and let people know. Because the key is, what good is a resource if no one knows where it's at and no one knows when it's operating? Our job is to make sure people know it's operating. Now, they talked about the incentive. You can't have a van there without support. So Black Health always gives supports to our van, and we make sure we explain to you how to get the incentive. The incentive is not that hard. Anyone who got vaccinated after July 30th, it's a little link. It's a link that we can get you, and then you just fill out the information, and you can either go down to the Museum of Natural History and pick up your gift card, or they'll mail it to you. And it doesn't, even if you miss the first time you got it, even if it's a couple of weeks later, even a month later, you're still eligible for the incentive. The other thing we have to do with these vans is we have to make sure people who do have been vaccinated get the Accessor Pass. Because a lot of folks are walking around with their cards like it's their whole life. And if they lose that card and everything else like that, they're going to be lost out on a lot of services. So we're trying to fight that digital divide by making sure people know where the links are to the vaccination vans, where the links are to the Accessor Pass, where the links are to the incentive. Because if we don't fight the digital divide, we're not going to beat this thing. Because people who are not part of a center, not part of a church, or not part of a team are getting left out. So when we do outreach, we flyer, but we go directly in the buildings and flyer. Listen, I was trained under Stan Michaels. So we go in the building and we put it right there in the building so people could see it. And then we know we got to come back a day or two later and put it again, because the anti-vaxxers will rip it down. But the biggest thing that we've learned how to really help people are these cards, okay? People went so crazy with flyers after the elections, they don't want to see more flyers. So we try not to hand out too many flyers on the streets. So every time we have a vaccine event, we put it on a business card. And we go into the stores, we go into the shops, and we talk with people. We talk with owners, we talk with the workers. We try to get the people who are left out. One of our main people we try to work with is the ladies who collect bottles on the street corners. We make sure they always get extra masks. We make sure they always get extra hand sanitizer, because they're doing a tough job and they have very little support. So the key to what we do is engagement. The key is knowing where all the vans are at, where the pop-up sites are at, and how we can make sure people get there. But these business cards have made it a lot easier, because we can leave 5 in the store, 10 in the store. We can give you them on the streets, and you don't mind carrying these. But folks is tired of flyers. Folks is tired of paperwork. And somehow or another, we still got to fight climate change and still beat this vaccine. So in closing, what I want to tell you is that our team at Black Health works together, and we're really upset for Washington Heights and Inwood because we have no walk-in sites where you need no appointments. We have no walk-in sites where you need no appointments. They closed down Yeshiva and they closed down Fort Washington Collegiate Church in June. And even today, if you wanted a vaccine van in Washington Heights or Inwood, there's none available. You have to go all the way down to 138th Street in Amsterdam at City College. Now me, I'm gonna have a vaccine van at Seatown on Sunday. Yep, they gave it to me on a Sunday because that was the only day available and I took it. And the way we're convincing people to come is, not only are they gonna get the $100, but we have giveaways. From Word Up Bookstore, we got books that are donated that we're gonna be giving away to the kids. And any youth, and in my world, youth is age 12 to 21, will get a free basketball or jump rope or football. Why do we do that? Because we don't want this to be a vaccine event. I'm Coach Dave. It's going to be a community event. So while we're getting people vaccinated, we're also talking to people about other things going on in the community. So when they see us set up, they find out information about school openings. They find out information about book giveaways. They find out information about school supplies. We don't just do the vaccine. When we come with our team, our job is to do community support and improvement. So we want to make sure if we, on a Sunday, we're still determined to sell out the van on a Sunday. That's what we're still determined. And I can get you the link so that everyone here can request their own vans, but you got to hurry because the demands for the vans are going up. But remember this, if you have an event and you don't have a van, make sure you know where the nearest van is so that you can send somebody. And now I know it's running late, so I will take questions. Any questions? I lost Steve. I guess I got to do this myself.
No, I'm back. I'm back.
You back, Steve?
I don't know where my picture went, but I'm back. I don't see any hands. Are there any questions? All right, Dave, you did another masterful job. Thank you so much.
All right, but I will get CB12 the relevant links that they need so they can put them up on their website and people can find out. It's not important if I know. It's important if you have the link to where the vans are at, the link for the incentives, and the link for the accessible pass. These are key things for us fighting this virus. All right, thank you very much.
I say, Dave?
Yes.
Allegra says that Coach Dave is a better resource for where the vaccine can be found than even the NYC Gov website. So that's
huge.
That's a pretty strong endorsement right there.
That means I got to live up to it. Like I told you, I have a team of young people who help me out from Black Health and from Mailman School of Public Health and from Uptown Team Dreamers. By all of us working together, we stay on top of things and we make sure when you do come to one of our events, you feel like community and you don't feel like you're a test lab subject.
Right, very good. You were made for this job.
Yeah, I was kind of trained for this. I agree with you.
Yeah, this is great. All right. Thank you so much, Dave.
Thank you.
1 second. Did you tell us how many people you think you've been able to get vaccinated through your efforts?
Directly at the cloth block party, they had over 90 people vaccinated. School on the Square had over 90 people vaccinated. On 164th Street, we only were able to do 60 and 70 because they ran out of doses. Okay, at the Coogan's event, again, we ran out of doses after 70 people. So the whole key is we've gotten, that's not even counting the people we just direct and send to other sites. You understand? Because we're constantly sending people on site. We have our own little text link set up. So every day people are asking me, where is the van? Where is the van? So we yes.
So you yourself have had 5 events and
we partner with Cloth.
Right. Okay.
We partner with School on the Square. We partner with Word Up. You understand? That's like people got to stop thinking it's just them. We have to work like a team. Even when Dodie had her buses up in Inwood, we were sending people up in Inwood and we made sure people know about it. We posted it. You know, like right now, we're on 133rd Street, and we have a van that's going to finish up at 10 o'clock.
Right.
So the key is we have to think like a team.
All right. So through these recent events, you've had maybe around 400 people who have been vaccinated.
400 people directly, easily.
Yes. Yeah, very good. Very good.
Yes.
Excellent.
And I'll be open on Sunday again.
And what time Sunday?
I'm going to be at Seatown from
Right.
10 o'clock to 6 o'clock.
Very good.
I will
Okay.
send you the information. Thank
All
you.
right. The Seatown right right near,
160 St. Nicholas.
right near Morris Jumel Mansion.
Right near Morris Jamel Mansion, another area that often gets left out.
Right.
That's where we go.
All right. Very good. Thank you for all your good work.
Thank you. And keep up the good support.
All right. I'll always support you, Dave. Betty Lehman, do you have a report about Isabella Geriatrics?
I do. We are dealing with the COVID-19 situation, much like the rest of the community this evening. But I wanted to let you know that we're following all Department of Health mandates. Pursuant to that, all nursing home staff must have their first vaccine by September 27th, and the second and third by October 18th or the 25th, depending on which type of vaccine they're given. If they're not vaccinated, they're not in a position to be able to continue to work at Isabella. So that's something that we're working on right now. We are hosting on-site clinics for the employees, so they don't have to take any time off or go anywhere else to get the vaccine. And we're finding that compliance is very good, and people are cooperating, so that's a very good thing. This particular mandate applies to consultants and vendors and volunteers as well. So anyone who comes on site must have had a vaccination completed or be in the process of getting it by September or October of this year. If they don't have that done, they're not allowed to come on premise. This particular mandate does not apply to visitors. So at this time, so what we do is we make sure that all visitors are tested when they come to Isabella through the rapid testing process, and they're provided with the appropriate PPE and other infection control protocols during their visits. And depending on the situation, we'll either encourage an in-person visit or a window visit, whatever would be appropriate in that particular setting. We have had a couple of instances of COVID over the summer, but they've been handled in a positive way. I think there were 2 residents and 3 employees over the course of the summer. And they were cared for, and everybody's fine and they're safe and everything's back to normal. Our community-based programs are doing well. We have the 3 North programs, that's the Recurring Retirement Community program, and we're providing care for them remotely and in some in-person visits where appropriate. Our resource center, which used to be at 169th Street, is also functioning remotely, and we're able to guide people on benefit eligibility through the phone. Yes. Steve?
All right. I think we lost the audio for a moment. Did you finish your report? Betty, you muted yourself. Yeah. Did you finish your report?
Oh, I wanted one more thing. We
Yeah,
did
go
have a staff reduction over the summer. We, like all nursing homes in New York State, probably across the nation, our census is not as big as it used to be. We have a 705 bed facility, and our census has been running about 550. So that's been pretty consistent. So we had to reduce some of the non-direct care staff over the summer. And they've been laid off, I guess, in the month of July. Some of them have been brought back because of other changes in staffing, and we've offered them the positions elsewhere in the organization as appropriate. So that's where we're at.
All right, and the nursing, the employees have to get the first dose by September 22nd?
27th.
27. And what's the date on the second dose? Was it October? Betty, do you have that October date?
October 18th and
18th.
October 25th, and I forget
Oh,
which is which. I think,
yeah, well, one would be for Moderna and the other one for Pfizer. And you're finding that people are willing now to get vaccinated.
yes,
All right, very good.
pretty, the publicity on this has been pretty robust.
Yeah,
So, you know,
because you did have some holdouts in the past, but now people are willing to cooperate.
the reasons that were discussed this evening, either unfamiliarity with it
Yeah.
or concern about safety, etc. And as Dave and other people have demonstrated, it's a matter of having a conversation and, you know, and kind of squaring away the facts versus the myths, if you will.
All right, thank you so much. I don't see any hands. So I guess we can now move on to the next item on the agenda, which is our preliminary discussion about FY23 budget requests. The office sent out to everybody the documents with the preliminary budget register on the items that the community board submitted for the current year's budget and the comments by the various agencies. And I sent you our one-page list to make it maybe easier to follow. So I would just like to run through our list pretty quickly, get some initial reaction, and we'll spend much more time on this next month as we come up with our new rankings. So the first item, the committee's first priority in FY22, and what the full board voted it as well as its number one priority, was to expand mental health services in the community, especially for seniors and others whose mental health and social engagement have been adversely impacted by COVID-19. My sense is we're going to want to keep that as maybe as our number one priority again. Our second ranked priority and the community board's fourth overall was to increase services to prevent and treat chronic diseases such as Alzheimer's, diabetes, cancer, heart disease, and hypertension, conditions that increase susceptibility to COVID-19 in our community. And I would argue that we probably would want to keep that one as well. Our third ranked item and the board's ninth overall was to increase trash basket collection on commercial streets in District 12, fully restoring the FY21 budget cuts. Ebenezer, you could probably fill us in on this. I think these budget cuts were restored, but I still see a lot of overflowing trash baskets and a lot of problems with getting stuff collected on the streets. Ebenezer, do you know whether this budget cut was fully restored?
No, I don't have information at this time, Steve.
All right, let's try to get it by the time of our next meeting.
Okay.
All right, our fourth committee priority and the third overall for the board was to increase staff to conduct regular noise enforcement, especially nighttime, air quality monitoring, and water quality testing in our community. Tanya, you have an opinion on this?
Hi, Steve. First of all, I'm sorry for coming late. I had to come after the land use is over.
Well, you know, I will never forgive you for that.
I know you missed it too. But yeah, I mean, I'm in agreement so far on what we have. I don't see any need to change anything at this point.
But you would agree, would you not, that that we need to emphasize having regular noise enforcement, especially at night?
Oh, definitely. Absolutely. That needs to happen, especially at night.
Okay.
That's very, very important.
Okay,
For
well,
sure.
all right, I wanted to make sure that that would still be, should still be an emphasis of ours. Number 5, our budget priority last year, and number 13 overall, was to increase funding for a targeted educational outreach campaign for COVID-19 prevention and support services in underserved communities such as Washington Heights Inwood. How do we feel about this one? Catherine?
Hey, yeah, my hand was up actually around the trash.
Oh.
In terms of not only is it the collection, but it's also that a lot of our street bins are the outdated street bins, which is like the open waste baskets versus the enclosed ones that we usually see downtown, or in highly gentrified neighborhoods, I should say. But I think in terms of the educational outreach, this might sound a little radical, but I feel like there can always be more funding around educational outreach, particularly now around vaccination. But I feel like if the higher we rank that, that's something that easily the city's going to come back like this is something that's already been included or it's already allocated for, which gives us a little room to think about, what other items do we want to kind of strengthen, knowing that, there's so many federal and state dollars around COVID vaccination programs. But something to think about.
No, that's an excellent point, because there is so much emphasis on this right now. And there is so much federal and state and city money being appropriated for this. I'm really, let's think about this between now and next month. I'm really not sure that we need to do much advocacy on this particular issue.
Should we, Steve, why don't we make it stronger and say we need vaccination sites? Instead of outreach, we need actual vaccination sites. Especially in Inwood.
Well, the thing is, like, keep in mind that this is for the FY23 budget that doesn't take effect until July. In my book, we need these vaccination sites now. We need them much sooner. And I'm not sure after people get the 3rd shot, they're going to still need to be vaccinated. This is an open question right now. I don't know whether we're still going to need to be vaccinated at next year.
Your resolution that we demand vaccination sites. And we have the statistics about how we've been ignored and how our vaccination rates are lower and how our risk is higher. So maybe we should consider a resolution.
I'm sorry, consider?
A resolution calling on the city to give us our fair share of vaccination sites.
I'm okay with that. But let's finish going through this list and then see what people want to do. Catherine, is that a new hand or the old one?
No, it's the old one. I'll lower it.
All right. All right, next on our list, number 6, number 22 on the board's list overall is to increase HIV/AIDS prevention and treatment services and LGBTQ services in our community. This is always needed. I would keep it on the list. Although maybe we should teach Daryl a lesson and then put it lower down. I'm joking, just joking. Number 7 on the committee ranking was, and number 6 on the board's list overall, was to increase substance abuse services in our community, including opioid overdose prevention education and funding for syringe cleanups and collections. This is still needed too.
Yes. I think that, like HIV, a lot of those programs have gotten short shift because of COVID.
Yeah.
There's even more need for those kinds of services.
Steve?
Yes.
Oh, sorry, go ahead and get through the list, because I was just going to ask if we were possibly would consider, something else, but go ahead.
Yeah,
I'll-
you can certainly bring something else up. Just give me a few more moments.
Sure, no worries. Okay.
Okay, number 8 on the list last year, number 23 overall, was to increase pest control efforts to eliminate rats, cockroaches, et cetera, in our community. Jay, were you voicing support for that one? Number 9 on the list overall, 16 on the board's list, was to provide funding to ensure that all local public schools have multi-service health clinics with nurses and social workers. I would want to keep that one. Number 10 and 43 on the list, the board's list, was to increase funding for education and outreach on recycling, reuse, and composting, as well as proper disposal of household garbage. The city is reviving its composting program, and I meant to send some information to all the committee members about that and to the board members, and we'll have to take care of that tomorrow. But I think education outreach on these issues is still warranted. And number 11 is to create an educational campaign about the federal public charge rule to inform immigrants of their rights to obtain health services and other benefits. What is, Tanya, do you know what the status is of that federal public charge rule? Was it thrown out by the courts?
Well, last it was challenged, and then that person is gone. So
Yeah.
I kind of feel like it's going to be moot because Biden is not going to support that.
Yeah.
It was yeah, online it's no longer in effect. So
Right.
that could totally be removed. So that's
Okay.
another spot
Yes.
for us.
All right. So
Absolutely.
So something actually got resolved. Very good. Okay, on the capital budget, our number 1 choice and number 9 overall for the board was to expedite the replacement of old water mains and sewer lines in our community. I think we need to keep that one. Committee ranking number 2, board's rank number 12 was to provide additional garbage collection trucks and street sweepers with snow plows. Ebenezer, between now and next month, could we find out from the district superintendent whether he agrees that he needs additional garbage collection trucks?
Sure. They asked me the other day informally that they need our support for the basket trucks. They would like that we advocate for this year, but I will follow up at the district service cabinet meeting and find out if they need that item.
So they told you they need the trucks.
The basket truck. Fund for the basket truck.
To do trash basket collections.
Yes, the extra one,
Okay.
the third shift. Yes,
All right, a second shift?
the second and third,
Okay,
especially
all right,
the
well,
one that is 4 to 12.
All right, wonderful. So that supports our expense budget request to increase trash basket collection. So we should expand the language to include having a second or even a third shift. Very good. The committee's third ranked item and on the capital side and 20th for the board overall was to install green infrastructure such as bioswales to divert stormwater from the sewer system in our community. And that's certainly still relevant. And continuing support was to construct a new District 8 garage and relocate its trucks from District 12. I don't know whether, Betty, have you heard anything in your neighborhood as to whether the city still plans to build that garage on, what is it, 25th Street?
I haven't. In fact, I was surprised when I saw this on the list earlier today. I printed out and I thought this was already done, but obviously not.
Yeah, no, I got it. I thought I might have read that the city may have, may not be going through with that plan. So we need to do some research on that item.
What they're doing in that area, are they building a lot?
Are they building a new sanitation garage there?
At all. I mean, they're putting buildings up. It's a lot of research with research buildings connected to Langone, NYU Langone Center.
Yeah.
I haven't seen anything at all on a garage at all.
Yeah, so that plan may no longer be in going forward. So that's a problem for us. So we need to look into that. Tanya, you had a suggestion for something else?
Yes. Well, I mean, again, it might, maybe we have covered this, but I'm thinking about, the climate change issue, right? And wondering, would we want to, looking at what happened in Queens and how that particular community was adversely impacted, is there a way for us to kind of study or a way to study what potential impacts could come to our community based on the unique situation? And plus, we're going to be doing a lot of the more development, things like that. So is there a way to sort of look at what the potential impact of climate change could be on this particular community up here?
Well,
Do you want me to answer that?
is that Allegra?
Yes, it is.
Sure. Yeah. I think it's a softball question for you. Yes, go ahead.
So there is a specific group, New York City Panel on Climate Change,
Right.
and they are focused on going like community to community and looking at the impacts of climate change. And there's a couple of different research groups involved with folks uptown. Like actually over the summer, a bunch of the interns, they did an urban heat island study where they went on set tracks through uptown, so through Washington Heights and Inwood, also through the Bronx, trying to get some more like street level data on that. So there's definitely that kind of street level research going on now. And if you want me to hook you up with some researchers who are specifically looking to that question, I can. I can also tell you that as far as like the Inwood rezoning went, because I was pretty active in everything that was going on, I tried pretty hard to push them to consider climate change, but it's just the nature of our current zoning regulations that climate change isn't really considered when they do rezonings. They have just a set piece where they consider greenhouse gases of buildings, and they don't fully incorporate climate change, like extreme rainfall or heating degree days or cooling degree days. Like when do you need AC? When do you need the heat? Those things aren't really being included in rezoning, but it's not that they're not being studied. They are being studied, but there's just, I guess there's no laws, there's no statutes that require them to be incorporated in that way. But I'd be happy to discuss that more with you or to hook you up with researchers who specialize in all those various things.
Yeah, maybe we can arrange to have the researchers speak to us and give a presentation to one of our future meetings. Yeah, so if you can put us in contact with them, that would be great. Especially if they did a survey block by block in Washington Heights and Inwood, I want to hear about it.
Yeah, Christian Bernayan, he actually won an award over the summer. He's a nice guy. I'll put you in touch with him.
Thank you. Thank you. Thank
you. That's great. That's awesome. Thank you so much, Allegra.
All right.
No problem.
Catherine, is that a
Yeah,
new?
no, I was gonna say the same, because a lot of our environmental points are really kind of hyper focused on waste. And so I think perhaps, and maybe for next meeting when we're all kind of like have more time with the budget, on the capital side, we have opportunity to add points around green infrastructure, particularly in the zones that like Jokarina was talking about. There may be some points that housing and human services might already include, right, in terms of like funding for NYCHA. But if anybody is on that committee as well, or we can kind of check in with somebody before, so that way we're not like all repeating the same capital items, or maybe we are and people rank them higher. So I was just gonna say that I think that we have an opportunity to put it in the capital side, particularly. And then there's also projects, I think it's called like the cool roofs, that they really focus around heat infrastructure, and like that was a campaign that We Act had last year. So I think even having expense items to talk about, like partnering with CBOs, to be able to mitigate for heat particularly, that's something that we can add. So I mean, I think absolutely yes, that we should try to boost up more environmental points. And I think even if they are more on the capital side, that's fine. Or being a little bit more creative on the expense side. So
Yeah, well, we have a whole host of expense items, but we certainly have room, I think, on the capital side for some more ideas. So let's give it some serious thought between now and the next meeting. Allegra, what did you post here? Yes, you're right. We are discussing a third dose. We should
Oh,
not.
sorry.
We
You've
should not-
moved on and I didn't want to interrupt you, but there is
We should not be
we shouldn't
calling.
say booster.
You're right.
We shouldn't be calling them boosters yet. We think
Nope.
that this may just be a third dose.
Right, you're right. You're right. Once again, you've corrected us. All right, so we have we've all agreed we're going to give some more thought to coming to these items on our budget list, and we're going to come prepared to the next meeting to hash this out and come up with a new list for FY23. Ms. Fisher, you had a suggested resolution? Sally, are you with us?
Yeah, that we demand our fair share of vaccination sites. I didn't realize that we had lost our site at Yeshiva. But basically we need more attention. We needed, especially with the third dose coming, but we basically, we know that we're higher at risk. We know that we're lower in terms of vaccination rates. So I think that we should introduce a resolution now calling on the city to establish a vaccination site.
And would you want that to be a 7-day vaccination site?
Why not? Why limit it? When did we lose Yeshiva?
I don't know. I was surprised too.
I think somebody said in June. I would say particularly because the emphasis has been that Inwood doesn't get because we have the vaccine bus steadily on 178. We have another one on 180th Street. I routinely see sometimes on near 181st, like on Wadsworth. So I think if we can have some language that includes for there to be a steady presence in the Inwood area, that would be beneficial.
All right. So this is a resolution proposed by Sally Fisher. Is there a second?
I will, Tanya.
Ms. Bonner?
Yeah.
All right. How many people are present here? Did we lose Jay Mazer? OC, is that a question?
Yeah, we lost him.
OC? OC, is your hand up? Okay. All those in support of this resolution, please indicate. Can you raise your hands? Or should I just call out names?
Call names since it has to be verbal.
Excuse me?
That when we vote, it has to be verbal. So I would say you can
Verbal.
call names.
Okay, very good. Betty Lehman,
Yes, I agree.
Tanya Bonner,
Yes.
Catherine Diaz,
Yes.
Sally Fisher,
Yes.
OC Camino. OC, You're muted. Jay Mazer. Wendy Pena.
Yes.
All right, Wendy, that's your first vote ever as a member of this committee.
Yes, it is.
All right, well, let's not forget that vote on an important resolution. Mr. Simon votes yes. Members of the board who were such as Mary Anderson.
Yes.
We have various members of the public. I don't know how to do this.
I guess with the public, they could raise hands since technically
I don't know, there are like
it's,
6 or
we're not
7.
recording.
There are 6 or 7. I don't think we can do that. Okay.
Yeah.
All right. So the resolution carries on a vote of 6 to 0 assuming OC, are you back with us? Oh, what happened to OC? OC. Okay. Okay. On old business, I don't have the DEP service request. On the street cleanliness ratings, on the acceptably clean streets, for the month of July, we were ranked at 89.6. Previous month, we were at 91.8. And the year before, we were all the way down at 69.9. On sidewalks, District 12 was ranked with acceptably clean sidewalks, 96.9. Previous month in June at 100%, and the year before at 97.9. I also sent out to you the latest update from the Department of Design and Construction on the project underway, primarily east of Broadway in the 180s, 190s, to install water and gas mains. It's 74.36% completed. And there's a detailed list of the streets where the work is underway. Under new business, Sally, did you have something to say about the Environmental Justice for All report?
Basically, comments went in last week. So I guess we're just waiting. I submitted comments, and I think probably a couple other members of the community did. We're just waiting to hear back from them. So, but the window's shut for submitting public comments.
Right.
I had other new business though.
Okay, the other item I listed here was on the resumption of the citywide composting program, and I will send out the details on it to the committee members as soon as I get the info. Sally, you had something else?
There are a couple of things. One is that we got allocated $10,000 as part of the Greener NYC program. We got allocated that last year to the community board. And last year we just, without any consideration by the community board, it got handed over to Cloth. I wanted to propose that it be used to help support a e-waste recycling event in our community, 1 or 2. We had talked last year about having one in Washington Heights. I'm not sure what $10,000 supports when it comes to Lower East Side Ecology Center, but I think that we should actually talk about how that money is used for an environmental initiative. And then there was a question that came up in the comments.
Well, let me just, on this point, I did speak to the director of the Lower East Side Ecology Center who operates that program. And she did tell me that each event costs $5,000.
So we could do 2 events.
Right.
$10,000.
Well, I support that idea. How do the members of the committee feel?
I mean, I agree. It's a better use of the funding.
Does anyone else want to speak on this?
I like the idea because I myself always have to run to Staples and get a car to drop off e-waste. I like the idea of either thinking of two or maybe a really big one and thinking how we can incorporate other areas of like I know you I forgot, I don't know if it was you or Osi that was talking about textile recycling. So if we have an opportunity to kind of bring in other methods of recycling, let's say, or like even composting education, then we can think about it as like one big event. But either way, I'm cool with it.
Well, I like the idea of doing two events and spreading it around because you need to make this as easy and accessible as possible for people if they're going to drag their stuff out of their homes and bring it to someplace. So you know, they in the past they've done an event up in Inwood, and they do very well up in Inwood. They collect an enormous amount of electronic equipment. But if we do this in Washington Heights, as the head of that program basically advised me, we really need to do significant outreach to make sure that people actually turn out for it. But I don't know, should we vote on this as a recommendation to the chair of the board and to the executive committee?
Sure.
All right, so all in favor of the idea of recommending that the $10,000 be spent on two e-waste collection events, starting with Betty Lehman,
Agree.
Tanya,
Yes.
Catherine Diaz,
Yes.
Sally Fisher,
Yes.
Osi, are you back with us? Wendy Pena?
Yes.
All right, and that's a yes from me. And Mary Anderson?
Yes.
Okay, very good.
And then one other issue that came up in the chat
Yeah,
about the use of Roundup in our parks that was basically eliminated or restricted by intro 1724, which is now local law number 56. It is still being used in our parks because there's an exception or exemption in the law for plants that are used to control invasive species or harmful plants, which are on the Department of Environmental Conservation harmful plant list. And the spraying that they had done recently, which caused a lot of upset in our neighborhood for good reason, was on poison ivy in Fort Tryon Park. Poison ivy is on the harmful plant list. So legally, the parks is within their rights to use Roundup in our parks, but ethically, given the cancer-causing properties of glyphosate, it seems like we need to look at alternatives. And we've tried to get goats as an alternative to Roundup. And so the issue was raised, you know, can we as a community work with parks to find a way to do this? They're doing it in Van Cortlandt, they're doing it in Riverside Park.
yeah. Well, I mean, the goats are really, you know, much more expensive than you might think. And it's not easy to secure them. And then they have to roam around in a fairly large fenced-in area, which then costs more money to put up the fences. And then you got to feed them. You got to provide security for them. I mean, goats, you know, goats is not, I don't think, really a feasible alternative. But the Roundup is being used in a very, very limited way. And, you know, but basically, I believe at this point only to deal with poison ivy.
I think there are other benefits to goats than just controlling the invasives. I think it would be something that the community would also really like. It attracts a lot of attention and it's educational. For $30,000, which is what it looks like the investment would be, it seems like something we should consider.
I don't, well, I suspect it's more than that, but,
Riverside got money to do that. Riverside.
yeah, well,
Conservancy, they have the money to do
yeah,
that.
well,
The
yeah.
goats are great. I love the goats. I love the goats.
Yeah, well,
But yeah.
and but they're they're running around in an area which I think is about 7, 8, 9 blocks long. I mean, it's a large area which is already like fenced in, and there's a lot of stuff there. A lot of invasives and a lot of stuff that's ready. That's not being otherwise taken care of. That they have a ready-made meal every single day. I don't know that we have anything comparable really at Fort Tryon.
No,
That would keep the goats busy for an extended period of time.
we do in Inwood Hill Park. We have plenty of invasives that they can work on.
Well, I don't know. We'll talk to. I have to talk to Jennifer about it. All right. Do we have any announcements? There is a 9/11 commemoration event in Fort Tryon Park Saturday at 6 o'clock on the Cloisters lawn. Everyone is invited to join. Anything else?
There's also service that day at Good Shepherd Church in Inwood that starts at 4 and continues. So that's an alternative for people in Inwood that are wanting to commemorate those who lost their lives.
All right. Well, it's 10:24. Wendy, our meetings are not always this late. Don't get too frightened. Do I hear a motion to adjourn?
A second.
Well, you're going to be first, I think.
Yes. Sorry. I thought you said it.
And I'll second.
Fisher is a second?
Sure.
All right. We declare this meeting to be adjourned. Thank you all. And let's think about our budget items and come back fully armed with ideas for next month's meeting. Thank you.
Thank you, everybody. It's nice to see everybody. Hope everybody had a nice summer. Bye-bye.
Take care.
Have a good night. Thank you for welcoming me. Looking forward to